So I've also really enjoyed the sessions this morning from both the clinician as well as the investor perspective, particularly around the challenges in the region for operationalizing and implementing digital solutions, but also on the contrary, what the opportunities are when there is adequate and proper and more coordinated investment in the rollout of digital tools, and where investment should be concentrated. So very much looking forward to the upcoming sessions where we'll hear more concrete examples from people who are actually implementing these solutions on the ground. So I've also really enjoyed the sessions this morning from both the clinician as well as the investor perspective, particularly around the challenges in the region for operationalizing and implementing digital solutions, but also on the contrary, what the opportunities are when there is adequate and proper and more coordinated investment in the rollout of digital tools, and where investment should be concentrated. So very much looking forward to the upcoming sessions where we'll hear more concrete examples from people who are actually implementing these solutions on the ground. So I've also really enjoyed the sessions this morning from both the clinician as well as the investor perspective, particularly around the challenges in the region for operationalizing and implementing digital solutions, but also on the contrary, what the opportunities are when there is adequate and proper and more coordinated investment in the rollout of digital tools, and where investment should be concentrated. So very much looking forward to the upcoming sessions where we'll hear more concrete examples from people who are actually implementing these solutions on the ground. So I've also really enjoyed the sessions this morning from both the clinician as well as the investor perspective, particularly around the challenges in the region for operationalizing and implementing digital solutions, but also on the contrary, what the opportunities are when there is adequate and proper and more coordinated investment in the rollout of digital tools, and where investment should be concentrated. So very much looking forward to the upcoming sessions where we'll hear more concrete examples from people who are actually implementing these solutions on the ground. So I've also really enjoyed the sessions this morning from both the clinician as well as the investor perspective, particularly around the challenges in the region for operationalizing and implementing digital solutions, but also on the contrary, what the opportunities are when there is adequate and proper and more coordinated investment in the rollout of digital tools, and where investment should be concentrated. So very much looking forward to the upcoming sessions where we'll hear more concrete examples from people who are actually implementing these solutions on the ground. So I've also really enjoyed the sessions this morning from both the clinician as well as the investor perspective, particularly around the challenges in the region for operationalizing and implementing digital solutions, but also.
My name is Naringwa Fiona Mothon, and I'll be taking you through today's program. Before we really get into the conversations, yesterday amazing conversations happened, also the day before that, and today we have amazing speakers lined up. We have panelists, we'll be hearing from startups. We'll also have time for startups and investors to also interact. So today will also be another amazing and rich day when it comes to creating connections, to networking, and continue to have the conversations around what it really takes to continue advancing tech innovation within the health sector. But before I start, I want to first start by thanking some of our partners and acknowledging them who have really made this event a success. I'd like to start with the Novartis Foundation. We also have the Global Fund. We have Patrick J. McGovern Foundation, Norscan, Bridge for Billions, and Village Reach. We also have numerous other partners who we have worked with and we really appreciate greatly. So let's start by giving them a warm round of applause as we appreciate them. So before we get into day 3, I first want to hear from the audience. I can see faces of the people who were here yesterday. Some of them were on the panels. I just want to start by hearing what stood out for you from the conversations that happened yesterday. And if it's your first time here also, what are you expecting to hear from today's session? So any volunteer who would like to kick us off with what were their key takeaways from yesterday and what they're expecting to get to hear today? If we don't have volunteers, I just randomly pick someone from the audience. It's fine. Okay, we have a hand here. Could we kindly have a microphone to the lady? Please do tell us your name and the institution you're with.
Hi. Hi, my name is Mayreen. I'm with the Global Fund. I'm just excited to hear the diverse panels today, and specifically the one on how we bridge the funding gap for digital health and for HealthTech. Thanks.
Amazing, amazing. Any other person who'd like to share with us what their key takeaway was from yesterday and what they're looking forward to today? Okay, we have a hand.
Good morning, everyone. Yesterday we talked about how HealthTech Hub Africa was founded to help governments and startups to collaborate on data and technology. Thank you.
Okay, amazing. Any other person? Maybe let's take 2 more people and then we'll begin with today's program. I'll also start calling out names because I can see some people at the back. Okay, we have a hand here.
Hi. Yes, okay, cool. Hi, everyone. No, I think from my side, I'm new to the HealthTech Hub, and it was quite amazing to see the big impact it has made. These aren't just normal small startups, like some of the stories yesterday, like Vula, and I still remember how Dr. Will said that every time your heart beats, they're connecting a patient with a healthcare worker or doctor. So I think the impact has really been amazing. That's a key takeaway from me from yesterday.
Amazing, amazing, great impact. Really also encouraging us all to really work together, finding solutions for some of the challenges within the continent. Last hand, any last person who'd like to share? Okay, we have, yes.
I'm Felix from Black Pearl. So for me, I'm impressed, with the grit and perseverance of our leader here, Lucy. I met her all the way in Senegal, and I'm just, amazed by how much effort she puts into all of this, and how far she goes with her startups, visiting Nigeria and some of the remote areas. I'm like, man, as an African, even it's crazy for me to do some of these things, but it's quite impressive, and yeah, it shows that this will definitely, go far. Yeah.
Amazing. Lucy there getting a shout out. If you're part of the HealthTech Hub, I'm sure you know Lucy and you know all the passion that she puts really into the work, as well as everyone else within Novartis Foundation and also the partners. So we're going to start with today's session. I'm going to start by introducing our first speaker for this morning, and she'll be speaking on the critical role of collaboration in advancing health solutions. A round of applause for Aisling Kwak. She is the Portfolio Manager, Digital Health and Financial Innovation at the Global Fund.
Good morning, everybody. Welcome. It is always a pleasure to be at the HealthTech Hub Africa. This is my second year coming to this summit, and I think it's really exciting to see that every year there's a more diverse audience that's attending. There's more impact to be talked about. And obviously we're here because we're all converts to collaboration, right? Otherwise we wouldn't be here. So before I share my thoughts and why the Global Fund has got involved in the HealthTech Hub Africa, I want to just play a short video which shows some of the outputs of collaboration. And shows what's possible through collaboration. So if we can just play the video, we're going to...
Technology and innovation are key drivers in the fight against AIDS, tuberculosis and malaria, strengthening disease surveillance, testing and diagnosis. Technology and innovation are key drivers in the fight against AIDS, tuberculosis and malaria, strengthening disease surveillance, transforming testing and diagnosis, and revolutionizing treatment. Here are 3 digital health and technology investments in Rwanda, helping to halt the spread of disease and strengthen frontline care.
Rwanda Health Analytics Platform has revolutionized the data analysis across the country. The platform integrates data from a wide variety of systems, tools, and sources, both within and beyond the health sector. The benefit of the Rwanda Health Analytics Platform here in Rwanda is to put all the multiple fragmented system in one single platform for analytics. In a matter of minutes, health authorities have all information they need to manage disease, outbreak, and monitor health programs. So this helps the decision making to know exactly what these cases can be mitigated as they arise in the healthcare system.
The electronic community health information system digitalizes the work of the vast network of community health workers. This means frontline health workers have patient data, updated records, and latest information on diagnosis and treatment at their fingertips. It does support community health workers to report the real-time data, mainly for maternal and child health, doing some prevention, as well as doing some curative services.
The HealthTech Hub Africa is a Pan-African health technology accelerator with co-working space here in Kigali. The hub helps develop health technologies across the continent and fast-track the best innovations into public health systems. The innovations the HealthTech Hub Africa has driven forward include Vula Mobile, a telehealth platform that connects health workers and people with HIV, TB, and malaria. All the innovations are data-driven and strive to improve health equity while strengthening the private sector and creating jobs. The value of innovations coming from Africa is simply because the innovators understand their communities best.
By investing in local digital health solutions, we can transform health systems and make patient-centered care accessible to all.
Great. So here you see some of the tangible ways that the Global Fund is engaging with digital health. And why are we doing that? And why are we here as a partner in the HealthTech Hub today? So for those of you who don't know the Global Fund was set up in 2002 by Kofi Annan with funding from the Gates Foundation and others. And it was founded to address the pandemic of the time, which was HIV/AIDS. And partnership was at the core of the establishment of the Global Fund. So we realized at that time that if we're going to solve complex challenges, then we cannot but work with others to solve them. And so from the beginning, we have partnered with the private sector, we've partnered with civil society, and most importantly, we work together with ministries of health. That partnership model and the collaboration with all of these key stakeholders has worked, right? So together with these partners since 2002, we've saved 59 million lives. But the fight is not over, because the reality is that unfortunately TB still kills somebody every 20 seconds. HIV kills somebody every minute. And more than 1,000 children will die today from malaria. And these are all infectious diseases that we have the tools to end. The challenge to addressing and ending these infectious diseases is compounded by all of the complexities that we hear about when we turn on the news today. Conflict, climate change, and economic hardship. So as the Global Fund, we understand that if we are going to do what we've been funded to do, then we need to work with others to do that, and digital health is a critical lever of how we're going to get there. And so we invest more than $150 million a year in data and digital health. But back to today and the role of collaboration. Systems don't create impact on their own, right? Digital transformation has to be driven by cultural transformation. And for cultural transformation, we need to work with different kinds of players. We need to embrace unlikely partners. And it's often through these unlikely partnerships that we unlock the creativity to solve these really hard problems. I want to give two examples of collaborations that I think are noteworthy. The first one is what you saw here in the video, Rwanda's electronic medical health system, or community health information system. I think what you didn't see in the video is the story behind that, because it is also a story of collaboration. So the ECHIS here in Rwanda was funded through funding from a number of partners, but including from the Global Fund through a data science catalytic fund that we have. And that's a fund that we raised in collaboration with private partners, in this case, the Rockefeller Foundation. So there was collaboration around the funding model. Rwanda was able to unlock that funding by matching that funding. So there was collaboration between the funder and the country. And last but not least, the design and implementation of that system is a really inspiring collaboration between the Ministry of Health and local developers and a Canadian company, Vernet. And I think it's a really nice example of bringing the best of local and global talent together. And by involving also community health workers in the design of that system, the result is a system which is user-centric and which is suitable and adapted to the local environment. And I saw this system in action last week. So the Ministry of Health kindly organized for us to meet with some of the community health workers who've been trained on this system. And I was really blown away by just the simplicity of this tool and some of the feedback that the community health workers were sharing. So one community health worker shared that on average she would spend 60 hours per month just in reporting. 60 hours per month. That's nearly a week of her time per month on reporting and not seeing patients. So with this new tool, she will be freed up to actually see patients. That's what we want, right? The other example that I want to give, which is another example of collaboration, and also the value of the HealthTech Hub is Vula Mobile. So as I mentioned, the Global Fund came on board as an anchor investor in the HealthTech Hub Africa this year. One of the things that we're doing within that partnership is sponsoring a challenge. So we sponsored a Data for Health challenge, and the winner of that challenge was Vula Mobile, who hopefully most of you will heard yesterday, an incredibly inspiring story and company. So with the prize money effectively from that challenge, Vula Mobile is scaling its solution in South Africa. And one of the, as they do that, they've been looking, they started with doing a baseline assessment. And because we said, look, how do we learn more about how HIV, TB, and malaria are treated in South Africa, also through your solution, in addition to you improving referrals for these diseases and many others, right? So they started with doing a baseline assessment, and they looked across the 75 specialities that are being treated, or that are being referred, I should say, through their platform. Now, the thing is, HIV, TB, and malaria are not specialities, right? They're diseases. So they looked at when somebody is turning up for general surgery, if they're turning up for endocrine surgery, how many of those, they're able to see how many of those patients have HIV or TB. And I think what has been really revealing is that there were, in both of these specific specialities, there were more than half of the cases that were HIV positive or who had TB. Now, if we're a funder, and like many other donors who are looking to work with governments to end TB, AIDS, and malaria, and we're only looking in we're looking in a siloed way at where we're most likely going to find, where we expect to find HIV patients, where we expect to find TB patients, then we're going to miss actually a lot of the patients. Because often patients will not have the financial resources to make 2 clinic visits, right? If they're going for general surgery, they may not have the resources to go for a TB diagnosis or for follow-up on their ARV treatments. So unless we're going to start taking a holistic approach to how we understand disease burden and how we engage with that disease burden, then we're going to continue to miss a vast majority. We're going to miss a lot of the patients that we need to reach. So this is just one example of the kind of exciting collaboration that we're seeing as being really critical for us and the ministries that we work with to engage with if we want to end the fight against TB, AIDS, and malaria. But this applies to many other disease areas, right? So patients are not siloed. So that patient with HIV or malaria probably also has a non-communicable disease. So as we think about how we fund and how we reach these patients, we need to be thinking very creatively and looking in different places to solve these challenges. So I think we're going to have a whole panel a little bit later today on funding, because I think when we talk about collaboration, it's not just about the what, it's also about the how. And we'll hear on the panel a little bit later this morning some of the challenges, but also the opportunities in how we can do a better job at collaborating when it comes to funding. So let me leave it there, and wishing you all a fantastic day here at the HealthTech Hub Africa, and looking forward to meeting many of you that I haven't met over the course of the day. Thank you.
Thank you so much. Help me now welcome our keynote address, Ms. Sarah Captains, Head of Medical Services at Penda Health. A round of applause as Ms. Sarah makes her way to the stage.
Thank you, Fiona. Good morning, everyone. How are you feeling? As a doctor in the room, I'd like to see a little stretch and jiggle to just warm me up. So good morning. My name is Sarah Kiptines. I am a medical doctor, a family physician by training. I have worked in different environments, from the government facilities to faith-based facilities and private facilities in Kenya. And this is a great opportunity. I got this opportunity 30 minutes ago. So I am going to be speaking from my heart. So, but let me just give you a little story. About 6 years ago, when I was working in a peri-urban facility, I was in the outpatient center, and I met a 35 tall, well-built gentleman in the facility. And he came in, it was cold season, and he came in with a cough, pretty, looking pretty healthy. And I was like, okay, so we checked his chest, he was fine. And I thought, you just have a simple upper respiratory tract infection. I don't think there's anything wrong here, some medication, and go on your way, be well. 3 days later, I got called by a consultant in the emergency room, and this 35-year-old gentleman came in and was dead. And I was like, what? When we reviewed the clinic visit and the visit I had seen him at, we were using paper-based records, right? And so a few pages before where the notes were, he had a heart rate of 140 beats per minute. Nothing else in his vitals. And that was the thing that made us think, oh my goodness, he may have had what we think was a pulmonary embolism, a clot in the heart, which I missed. And that was the point when I realized that the system I was using, the paper-based system, it was an error I made. I failed to look back those 3 pages, but also the system didn't help in that situation. And it wasn't just me who saw him, there were the nurses, there was a whole team who missed that as well. So we lost a patient. And ever since then, I now work in Penda Health, and Penda Health has had a wonderful journey of starting paper-based, and right now we're in the front line of AI generative tech system. And one of the things why I give that story is not to reveal or be vulnerable with the error I made, but to just show how health systems and technology and innovation in health systems actually saves lives. Can save lives, and we as doctors, as clinicians, must embrace it. In Penda Health, we see about 1,000 patients a day, and we have a team of 250 healthcare workers. And in this journey of introducing technology and innovation in healthcare, we get mixed feelings and thoughts from patients and even from the clinicians using it. I think we've had a lot of stories of from the developers here and the techies saying, oh, doctors are the hardest people to work with. No, that's not true, but we are challenging, we are complex, we have brilliant minds and angles of thinking about things. But there's something that's very key about technology and how the importance of embracing tech innovations in health systems that I summarize as making room. Technology makes room. Makes room for multiple things. It makes rooms for learning and development. It makes room for data collection, for research. There's so much it does at the different levels, from the user, from the patient interacting with technology, to the doctor, the clinician, to the developers and the pharmaceutical companies around here. It makes room. But one key thing in the consultation room that it makes room for is what I call the art of medicine. So technology really does support the science behind it. I'm able to interact and with a patient, say all these symptoms. In that case, the high heart rate would have been, shouting at me and letting me know that there's something you need to do here with this abnormal vital. And the technology can support me identify and screen a patient who may have hypertension. It may help me identify a high-risk patient just by the data that is coming before me just because of the technology. And it helps me with the science and building and thinking through what I need to do for this patient. But it does make room for what I call the art of medicine, which is how I interact and engage with the patient. Once the thoughts, in the 8-10 minutes I have with a patient, I can see the same patient, 3 women with bleeding, with the same symptoms, but each woman has a different need. Each woman has a different idea of what they think is going on. They have a different concern and a different expectation that I'm supposed to offer as a doctor. That's the art of medicine that technology cannot see. Technology will not see the anxious patient before me. The technology will not see the financially constrained patient before me. But if I have technology able to guide me and support me in the actual diagnosis and development of the science side behind it, it now makes room for me to be present for that patient. It makes room for me to be able to address the other needs. It creates room for me to build trust in the relationship I have with the patient, but also in turn build trust with the technology I'm using. So one key thing I want to just charge all of us is that to remember that as long that the final beneficiary, we are all, there's so many people in this room. We have the developers, the investors, the entrepreneurs, we have the doctors. We don't have a patient. We are all patients at one point, right? And remember that the final beneficiary is the patient. So as we think through all these innovations, remember to think about the patient at the end and what this allows for them to like the benefits that they get from it. It's not just, it's not purely just what's the word? It's not just purely to get, we do want to make money. We do want to serve the community and the countries that are around us. But we need to remember that the individual person in front of us is the most important beneficiary of all these products we're developing. At Penda, we like to say our tagline is to live life to the full. And that's what healthcare is all about. We want to offer these services. We want to be able to treat our patients so that they can live their lives to the full. They can achieve their goals, their dreams, their aspirations, start their businesses. And the only way to do that is if we focus and remember that at the end of the day, there are two arms of medicine. There's the art and the science of medicine and the art of medicine, which innovation allows us to pivot and look towards. Thank you, everyone. Have a lovely, lovely day.
Thank you so much, Sarah, for that, sharing your personal experiences and just showing how technology is really crucial when it comes to driving innovations within the healthcare system here on the African continent. We're now going to get into the first panel for today, but before that, I'd like to mention that we have a brown leather bag that someone forgot outside. So in case it's yours, you can just pick it from the team there. We have the protocol team who will help you get it. So the panel discussion will be on innovative financing mechanisms for health tech. Once again, as we invite our panelists, a warm round of applause, give them the energy needed because this is going to be a very crucial and very important conversation. If we do have time, towards the end of the panel, we'll have Q&A from the audience. The first panelist, I'll start with our speaker for this morning, Aisling Kwak, the Portfolio Manager, Digital Health and Financial Innovation at the Global Fund. The second. She is an entrepreneur with 20 years experience across health, financial services, and fintech in business development, investment, and public policy roles. She also special interest in Africa and leveraging technology, global networks, and capital markets to align frontier investments, ESG, and business development with the continent's opportunities around access to finance and health. Our next panelist, we have Alex Ntade. I think I've just seen him. Oh, there he is. Alex, thanks for joining us. He's the CEO, Rwanda ICT Chamber. His work at the Chamber involves bridging the gap between private and public sector players in the ICT industry, as well as overseeing and establishing new innovation programs for technology startups and innovators among them. He sits on the advisory board of numerous committees. He's a passionate enthusiast of technology, innovation, and financial markets. The third panelist we have is Dr. Dino Rech, CEO, Odere. A round of applause for Dr. Dino. He is a recognized global health leader, published researcher, and physician with first-hand knowledge of the impact of technology on health system progress and outcomes. Our fourth panelist, we have Seu Steve Tawia. A round of applause for Mr. Seu Steve. He is the co-founder, managing partner at Java Rift Ventures. He's a finance leader with over 20 years of experience in impact investing, development and blended finance, strategy consulting, angel investing, and venture capital / private equity funds, as well as funds in Europe and Africa. And our last panelist, we have Arun Kumar. Arun Kumar, there he is, a round of applause as he takes his seat. Principal Investment Officer at the African Development Bank. He's an investment and strategy specialist with about 2 decades of experience in designing, funding, and executing high-impact projects in emerging economies. And our moderator for this session is none other than, drum roll please, Lucy herself. She is the Director of Digital Transformation at Novartis Foundation. I'll read briefly just something short from her bio. She is responsible for the digital transformation strategy at the Novartis Foundation and its execution with the aim to transform population health enabled by data, digital, and AI. She is also Program Director and Coach on tech-driven initiatives. So, let's give the moderator and the panelists a round of applause as Lucy takes it over.
So first of all, good morning, everyone. Did you have a good night? Was yesterday good? Who was here yesterday? All right, so half of you kind of have a good idea what we were talking about. Today, I would have actually a job for you because I know all these people quite well, so I'm going to interrogate them in my way, but I'd love for you to share the burden. So half of this panel, the questions are going to come from you. So let's make this a little bit more different from these very classic panels, and let's have a real conversation. So it's my pleasure seeing all of you here coming from different countries with different backgrounds. So let's start and talk a little bit about money, right? I would like to start from Steve because when we were talking a little bit a few days ago, actually, and Wilfred was so kind to give us the big picture on what's going on in terms of the big numbers on the continent, we had some discrepancies, we had some surprising numbers. Steve, can you give us a little bit of a reminder as to what's going on in the investment landscape on the continent and why is it a little bit different from anything else we see around the world?
Working. Hello? Yes. Thank you very much. So thank you very much for the question. So I think I'll take 2 views. One is the macro view of investments on the continent, and the other one is specifically on healthcare. So in terms of technology investment over the last, I would say, 5 years, we've gone from a mere 1 billion to a maximum of 5.2 billion in 2022. Out of that, you would, on average, realize that about 130 to 150 million only has been invested in tech and health tech or healthcare specifically on the continent. So that's really paltry, right? And so the question is, how can you increase the interest of more venture capital, commercial, or impact investors to the continent? Because a lot of the capital that is coming to the continent is donor-driven, public-driven, and therefore those numbers also need to be added together to give the bigger picture. So today, one of the things that you need to understand is that in terms of bigger numbers, in venture capital and private equity on the continent, about, as I said, 150 million has been invested in healthcare, health tech, medtech, biotech, and related sectors on the continent. I'll stop there.
Wow. And I get the feeling that different types of ecosystem players and investors and funders have different requirements. That was something we were talking about with Arun earlier. And Arun, you're really, really, really experienced in this field. You have definitely a different lens working for a large lender organization. Can you talk a little bit about the ecosystem stakeholders and why do they have different requirements and how potentially how can they work together potentially? Is there such an option even?
Thank you. Thank you, Lucy. Thank you so much for the introduction. I think let me give you a brief background on the institution I represent. African Development Bank, most of people you know about African Development Bank, we are a public and private sector development bank. We do about $6 to $7 billion every year, investments. Right? So that is across different sectors. Health is one of the priority sector for us. We look at health and pharma as a one package. What we are looking at in next 5 to 6 years is about $6 billion investments in healthcare, pharma, and health tech is part of that. Now, Lucy, coming back to your question, we have to look at a different aspect. Every stakeholder has a different mandate. And we have to look at they are driven by the mandate. Let me give an example. The government is looking at public sector healthcare investments, right? Looking at low income, part of the society, middle income, looking at a primary, secondary, tertiary healthcare. And when you look at donors or NGOs, I would say, in community-based facilities, they are also looking at something, outside of the cities and rural areas, villages. Now, if you look at private sector, they are looking at, Kigali kind of a setup or Lagos, where there are a lot of patients for middle class and higher class, because their primary objective is that whatever amount they are investing, there should be a decent return. The challenge is what they are facing and the risk they are taking for the investments. Now, development partners, definitely, HealthTech and other development partners we are working, their objective is to sensitize the demand, sensitize the discussion, public dialogue with different stakeholders. I think key here is that, let me tell you that there is no dearth of money. There are a lot of capital available. The question is, are you talking to the right partner based on their mandate? That's very important for you. Now, there is another point I would like to also mention to the tech developers. I'm not very experienced as far as the healthcare tech is concerned, but I'm an investment person. I know that where you need to put $1 and how you can get the return for that. So you have to always look at, when you're developing any product or any app or any technology, you should bring 3 stakeholders into the room. Government agencies are very, very important. You need to have a discussion with them about your innovation, what you are doing, regulatory aspect, how you're going to implement it. Then definitely second is their development partners, who are going to support you, and the mentors also look at. And third one is definitely private sector, who is going to finance or who is going to buy a company after, maybe down the line. So I think these are the collaboration is very, very important, and continuous dialogue, knowledge management. Lucy, I think I need to emphasize this point. Knowledge management is very, very important. On the continent, the biggest challenge we have is knowledge. We have we produce our knowledge, let's say for a specific sector or a specific company, and then we keep it to ourselves. But if you do more and more research and share with a platform, that is very, very important. That will sensitize the demand as well as educate the whole ecosystem. I think that is very, very important. Thank you.
Thank you so much for picking on the different roles within the ecosystem. I'm thinking about, Aisling, about you. What is the Global Fund doing in this space? And can you maybe also talk a little bit about the way you're choosing your investments and how you're thinking about impact when you do so?
Yeah, thanks, Lucy. So as I mentioned earlier, we put about $150 million per year to work in terms of grant capital. And that includes grant capital that we make available to countries through our core grants, as well as top-up funding, let's say, that is channeled through digital health-specific funds called catalytic funds. In terms of how that funding is allocated and how it's spent, it's really a function of a number of things, but we're very much country-driven. I mentioned earlier our partnership with countries, so we don't have offices in any countries. We're based in Geneva, and then because we are very much country-led, and our partners are the Ministries of Health, it is the Ministries of Health who decide how they want to spend or invest their Global Fund grant allocation. And that funding gets, we raise it every 3 years through what we call a replenishment process. It gets allocated, and then countries decide, also depending on their disease burden and the maturity of their health systems, how they want to invest that. What we're seeing is that more and more countries are looking to increase their investment in systems to support digital health. but it's still a very small percentage. I think it's probably less than 2% of the overall grant funding that countries use for investments in health management, information systems, etc. today. So that's why the catalytic funds are really important, because they are funds, that is funding, top-up funding, as I say, that countries can only access if they agree to match some funding from their grant and invest it specifically in digital health, right? In terms of what they invest in, again, largely country-driven, because it's important that what they invest in meets the needs of their own ecosystem, albeit there are a number of criteria that we do that we do apply, and that's that these investments from the catalytic fund specifically need to be catalytic, right? So it needs to go to things that maybe ministries of health would not have the risk appetite or the budget to invest in otherwise. So I feel there was another part to your question, but I've forgotten.
Impact.
Impact, yes. So in terms of, yes, so how we choose the countries and the impact. So for the grants, we don't choose the countries, right? As I say, we work with more than 130 countries, and as I say, the countries decide how they want to invest that funding, if it goes into digital health or not. For the catalytic fund, that's where we look at impact, I would say, more intentionally. So we look at countries that have digital health policies in place, and where there is evidence of committed leadership and government support for digital health transformation. So it's no surprise, for example, that Rwanda is one of the countries that is, receiving funding from our first catalytic fund together with the Rockefeller Foundation. So the existence of community of digital health policies and the active engagement of the Ministry of Health is critical. And then in terms of, we're now moving on to our second digital health fund in January. And yes, we are looking also at the impact that has been achieved through the investments in the first fund, and we want to build on those. So for example, and that includes widening the scope to accelerate the impact that has been achieved, and also to meet some of the gaps that were there. And we can talk separately maybe about those.
Thank you. Alex, tell us, what is Rwanda doing in this space? How are you stimulating investments both inside of the country, from outside of the country? What is Rwanda doing in this space? And do you think that we are going to, I say we, but I feel like I'm Rwandan. What is going to happen in the next couple of years so that probably Rwanda kind of comes as one of the leading countries, just like we hear about Kenya, Nigeria, South Africa, in terms of the amount of investments?
Thank you. So what is Rwanda doing? I think that puts me in a government position, which I'm not. But I'll nonetheless try to share at least what I know. And I think the basic, very, very basic starting point is a business-friendly environment. And that is a process that has started quite some time ago, and until around 2011, 2012, when actually we started looking into, digitizing services. Whatever service today, Irembo, I think most of us are familiar with Irembo, even those that apply for visas online. So a business environment, a conducive business environment is important. Secondly, the infrastructure that has been put in place, because you're not going to deploy any digital health system if there's no connectivity in the places where you want to have that. And so once the infrastructure is in place, you have the policies as Kwak has shared. You have digital policies to actually implement that help the healthcare system and players to actually know what they're doing and how they're going to go about it. So first and foremost is the laying of the ground, institutional systems in place as well as the infrastructure. Second, taking bets. Okay, so what we have seen again, it's no secret. Zipline is in the is in the healthcare space. It's a drones company, tech, high tech, or deep tech, as they call it. And Rwanda says, look, we need to see how let's test this out. Everyone else in the world is skeptical about it, but we'll give it a shot. And sometimes things work out, sometimes they don't work. Luckily for Zipline, that worked out. Maybe for Babil, it has not worked out exactly, but it is not on the Rwandan side, it's on the global side where things haven't worked out. But if you look at the impact that Babil has had, so where am I going with this? It's to look at, to have a systems view that funding is not, or funding healthcare is not the only thing. Yesterday, the Minister Sabe, shared the fact that in hospitals, in healthcare centers, what data has showed in Rwanda is that 80% of the time that the patients spend in healthcare facilities is actually not with the doctor. It's on other things, payment, register here. See, so you realize that the healthcare system is not just built by medical professionals alone, but all of us are in one way contributing to it. So that means that when we look at financing or innovative solutions for financing this sector, and what Rwanda has been trying to do is to really look at the enabling factors. Before we go to the, yes, we're also tackling and handling on the patient part, but there's the other systems that need to be in place for quality health, for quality healthcare services to be achieved. And that brings me to the value chain, let me call it a theory or a thesis that I have, that we need to look at it what resources do I need and for what, okay, and where. So, because as, if it's a health tech company, since you asked me why aren't we having so many in Rwanda, if it's a health tech company, there's maybe an R&D phase that you're going to have. Then there's going to be a prototyping or customer validation phase you're going to have. Then you're going to have a real go-to-market and scale, or even just a POC, and then you need to scale. Along that value chain, you need different financial instruments. So the challenge sometimes we try to do is to try to address this one financial instrument for the entire value chain or for the same category. So I think this is what I would want to see Rwanda do more, de-risking in a way. I think at first I said, what are you financing? So today the startups that are in the health tech hub, there is some support they're getting. Some of it is financial, some of it is non-financial. But even the non-financial, someone is paying for it. Hence the collaborations. So that for me, I think is one, the thought process that we need to look into, and then we will be able to attract more because we'll have de-risked and given investors comfort that actually when they put their money here, it will grow.
And that sounds definitely promising. Dino, in the entrepreneur shoes and investor shoes, I just wonder, tell me, is there a problem around sustainable financing? Is there a problem about availability of funding from your perspective, in your experience?
Thanks, Lucy. So I've got like two hats. My current hat is an entrepreneur in health tech, but previously I was a donor at a major global foundation. And I think we have almost a systemic problem in health tech, specifically when the tech is targeted on impact in LMIC settings. And it starts with a couple of words came up. One was mandate. So within disease, especially health tech that is cross-cutting. So within disease areas, there's mandates, a malaria mandate, an HIV mandate, a pneumonia mandate. if you have a cross-cutting piece of technology, and I'll use Vula Mobile as an example, Will's here somewhere, I'm sure he doesn't mind. Vula is cross-cutting. It's a referral platform, and Aisling mentioned it, that benefits multiple different areas. In 2007, with my donor hat on, I tried to raise money for Vula in this capacity. And each disease silo that I went to said, it's an interesting idea, we see it helps, but it's not within our malaria mandate exclusively or our HIV mandate exclusively. So I love what Global Fund is doing and others with the Catalytic Fund. It's less restrictive, it sees the big picture, it isn't mandated in a restrictive way in terms of a particular disease mandate. It's more ecosystem friendly, and I think that's helpful. The second challenge comes when you say, and I'm going to get probably criticized for this, but the country has to lead the ask, right? In the history of innovation, just not health tech, often countries didn't always know what the innovation could be in terms of its impact. Again, in the South African setting, when Will designed Vula to change how referrals were done, no one thought there was a massive problem. You know, the government itself was like, our referral system's okay. They didn't see the room that could be created, to steal your term, which I loved, the room that could be created with a referral tool like this until a lot later. But global donors need governments often to make the ask. If they haven't yet understood the impact of the tech, we're in a bit of a catch-22, guys. So the mandate is a problem. The ask having to come from a government is sometimes a problem when you're talking about innovation and you're talking about the startups in this room. So my appeal would be, as an entrepreneur and representing others, more of what you guys are starting to do. And the budgets in the grand scheme are still small. You spoke about 150 million. The catalytic funds are a much smaller component of that. Global Fund's total annual budget is 5 billion. We're talking about fractions of percentages. How do we as a global health community understand this catch-22 that health tech is in and unlock it? Because often the people who need it can't pay for it. So it's not so easy to go to private venture capitalists. They want a return on investment. How are we going to pay Steve's venture capital company if our users can't? They need the tools, they need the impact, but they can't pay for it. So who's the payer? Who supports it? How does it get to the next step? We need more of what you guys have started. Thanks.
I think Steve is dying to comment, and I'm going to ask you. Can you tell us, how are you striking the balance as a VC? Can you tell us specifically for your VC, what's your horizon for an exit? Can you give us a bit of a feeling, also the size of the tickets?
Maybe as a reminder, so Jazari Ventures is a health tech, med tech, and biotech VC fund for Africa. The whole point is we realize that there's a funding gap, and obviously we've been talking about it, right? Between, I would say, about $100,000 to about $2 million across the board. Because most often than not, entrepreneurs go through incubators, accelerators, try, and sometimes I call them grantpreneurs, because at some point they realize that they've been churning grants, and things are not moving. But I think there's a business model where you can do what I call B2D, business to donors or business to governments, try things out, but very quickly need to try and balance B2B, business to consumers, or business to consumers. So there's a kind of a track. And I want to rebound on what Dino said earlier, which is, the minister, the chamber person, sorry. Yes. On the point where you need different instruments for different stages. So for us at Jazari Ventures, really want to invest from 50,000 to 2 million. And what we realized is that actually there's also an element where we actually considering setting up a venture studio that would essentially do this particular work. And I want to give a bit of history on venture capital and how this developed, right? When you look at the history of venture capital globally, it really started from the government, even in Silicon Valley, right? You have DARPA program, IQTEL, etc., that systematically funded massive programs with grants from 100 to billions of dollars, literally, to support entrepreneurs. So the programs that we are seeing potentially can have a way where we can do what are called challenge funds, where we say, look, let's give you an opportunity to solve this particular problem. We'll fund you from X to Y, proof point or results-based financing, Once you've gotten this to stage, we can help you to get to the next stage. By that time, we'd have de-risked a lot of the questions that we're asking, and therefore get to the next stage. So what I would say is that if you can come to a kind of, and that's like a dream, let me give a big number, 10 billion innovation fund for Africa, where each country can tap into a certain amount as a percent of GDP and start systematically going into innovations, right? And churn. I'll stop there.
Arun, do you think the bank can help setting up something like that? Is this part of your strategy?
Yeah, Lucy, I think first let me tell you, I don't know why, is it deliberately you gave this position where you have donors, then you have a government agency, then you have an entrepreneur, then you have a VC fund, and then you have a big brother. Okay? So as far as the pocket is concerned. So
That's so funny.
But I think, I really like the idea, Steve, the innovation fund. I think Alex would be aware about this, that we have invested into a Rwanda Innovation Fund. I think $40 million we invested, 30 million, yeah. And fortunately, I was the guy who was behind that, not in the front of, but the behind in approving that project. So that is exactly the same thing what we did. What we did is that we gave a $30 million to government to manage these $30 million across different industries. Agriculture, I think there was HealthTech also was part of that. E-commerce was part of that. Energy was a big part of that. So, but with 30 million, I believe that the more than, I think, $300 million must have raised, because that $30 million has gone into seed or pre-seed level or A level. Now, let me give another example. We have approved a project in Nigeria that was $285 million, similarly, to build up and innovate the local industries in Nigeria. And that fund is going to raise another $250 or $300 million from the government pocket. So that we have almost $600 million fund available. So I think what we are doing as a bank, we are supporting the ecosystem at a different level. We are supporting the government for their the work on the public sector. Then we are providing some sort of a grant element depending upon the country. We have a classification of the countries which are high income and middle income. Then we have a low income countries. So we have different pockets, I would say, where we use a concessional window or donor, some of the grant also to the countries. So there is a possibility of working, and we have been working, I think, to providing and supporting the local ecosystem. Even the VC fund, ParkTech, we invested. There are Cathy, there is a Django. There are so many funds. We have about 85 funds we have invested in. So at the level, as CSO level, we have an innovation lab where we support, we have about $10 million to support the local ecosystem. We call it enterprises, local companies or local VCs who are developing the companies in the region. So we normally call for proposal for the grant. So we have about $10 million in that. We utilize, I think, $4.5 million. We have still some amount available. So we work with, our role as a bank is to provide risky capital. We provide grant elements. Our role is to go outside of Africa and market about Africa and bring capital from in a different pockets, right? Sometimes we have partnership with Japan, Korea, and other governments where they want to motivate or kind of boost the local entrepreneurs. And Job for Youth in Africa is our one of the cross-cutting strategy. Lucy, you talk about impact. As a bank, we look at an impact at a different level. We look at how much capital this amount is going to raise. If we are putting 1 million, how much this capital is going to raise. That's the first thing. Second thing is how it is going to support the local citizen, low income patients or low income part of the group. That's very, very critical. There is no exception. If the project is not qualifying that criteria, straightforward no go. I think that's what we look at. Thank you.
I would love to pick on the impact piece again, looking at Ashlyn. Can you tell us a little bit more why, for example, the Global Fund got involved with this particular initiative, and why, despite of the high level of risk of some of these new health tech innovations, you still decided to support them essentially?
Yeah, thanks for the question, Lucy. So as I was mentioning, I described earlier kind of how we typically fund digital health, right, through grants and catalytic funds. What I didn't maybe explicitly say is that, but you've probably gathered, is that we invest mostly in the enabling environment or the enabling ecosystem. But I think what we've realized, and coming back to some of the statistics I shared this morning in terms of where we find ourselves with ending TB, AIDS, and malaria, and also making or helping governments to really embed resilience in their health systems, we realize that we need to go beyond what we're already doing. And we have always fundamentally believed in the role of the private sector in solving these complex health challenges. But we've never really figured out how to engage with, I would say, local private sector and entrepreneurs. So, we have partnerships with the likes of Microsoft, with Google, with Orange, with Siemens, a number of big tech and health tech companies, and Novartis Foundation. But we haven't really figured out how we engage more intentionally with local innovators. And we recognize that that's a gap in how we're working, because coming back to the people who know best how to solve the problems are the people who are in country, right? So in addition to working with ministries of health, we also need to be working with local private sector. And so when we learned about the initiative that Novartis Foundation had taken in founding the HealthTech Hub here, it was a very obvious choice for us to get involved. We don't have the bandwidth, the skill set, the mandate, coming back to mandates, they do matter, to get involved in kind of one-on-one support for entrepreneurs. So we needed a mechanism through which to engage with entrepreneurs and to tap into that talent and the solutions that reside in that segment of the local private sector market. And the HealthTech Hub is that. It is a platform for public-private partnerships ultimately, but most importantly, one where the innovations that are coming out of the hub are shaped by the needs of the public health system. So for us, it's a no-brainer to be here. So I think that's the why, and then I think, coming back to the funding question, I think for us, part of the next question that we're asking ourselves is how do we go beyond kind of the what and start looking at the how in terms of the funding that we raise. And it's significant, right? So in our last replenishment last year, we raised $15.7 billion for health. How do we start channeling or using some of that to go into stimulating health tech on the continent? And how do we do it in collaboration with other players? So I'm going to be following up with all of the panelists and some of those of you in the audience to see how do we start thinking about whether it's a venture studio or an impact fund to really solve this problem of the missing middle.
So I obviously, I kind of am involved in a number of groups where we talk about the need for more in terms of amounts, but also more coordinated funding. Steve, I'll come to you in a second. But one topic I usually like to touch upon is the regulatory and policy environment. I would love for one of you to guys comment. Do you think there is sufficient harmonization when it comes to different countries? Is there sufficient maturity? Sorry about that. It's a genuine question. And what can we do to have a more stimulating environment in which technology can be easily transferred, can easily scale from one geography to another, in which data sharing can be, how should I say, balance between being safe, but also allowing for innovation to thrive between regions in Africa, and so on and so forth. So anyone wants to kind of piggy? Okay, Dino, please.
I'm happy to take this one and speak from some experience in South Africa. And again, when I make statements, I think there's outliers to everything, right? There's countries with very good regulatory bodies. There's others that are more nascent in understanding tech. But as an example, during the COVID pandemic, a lot of countries wanted to introduce digital health tools for screening and even for assisting with data capture. There was a notion of using AI to read COVID tests. And there was a question about if you took a self-rapid test and incorporated with a digital health tool, a companion app, how was that assessed? How was it approved? And the truth is regulators had never dealt with it before in many countries. So within the regulatory bodies themselves, they weren't sure how to handle it. And then we started to, global health bodies started to assist. They started to reach out. And in South Africa, we had the sad situation where our regulatory body approved the first COVID self-companion app at the end of the pandemic when it was pretty much done, when there wasn't a need to test anymore. And that's how long it took to get. So I'm sure Rwanda was a lot quicker, and there's other regulatory bodies that are faster. But I think it is a growing concern. What is a medical device? What constitutes it? What is the framework around assessing it? When you have someone coming to you with AI, how do you know it works or doesn't work? How does a Ministry of Health official evaluate different models, when he's trying to make a decision? It's a big gap and a big gray area. Can I add on one thing while I've got the mic? It's somewhat related. We've spoken a lot about funding buckets and more funding. And it relates to regulatory in that a lot of things are unclear to the entrepreneur or the health tech company. The regulatory pathway is one. But knowing where and how to access different funding buckets and what they're for is another. And it's something that if the Health Tech Hub doesn't already do, could be an opportunity to give clarity on that. If I'm an early tech startup, what are the different foundations? I'll give an example, Botna Foundation. They fund digital health. They're very Tanzania focused. If you're a Tanzania entrepreneur, you should be going to them, especially if you're in youth. Steel Foundation has a specific mandate, Wellcome Trust. But it's taken me 15 years, and I still don't understand all the foundations and what they do. So how do you fast track that for Penda or someone new that's trying to figure out, there's all these global foundations, there's lots of philanthropy, but which ones are country specific, which ones are mandate specific, which ones are on strategy for me, and how does the global health ecosystem and that maybe Novartis or the Health Tech Hub make that easier? So it relates to regulatory as like both are gray areas. Yeah.
I love this. It starts like feeling we're in the startup parliament here. It's amazing. So Steve, please react. I know you were dying to react.
A quick question to the audience, just to make people understand the information asymmetry, right? So, who can name me the biggest tech exit on the continent so far? Just a name.
He's buying you drinks.
No, those who know, like him, can't talk. Just a name. Like, is it in fintech? Flutterwave? They haven't exited yet, but they've raised a lot of money. Yeah, good point, yeah. Stripe, yes, but it's not the biggest. Thank you. InstaDeep to BioNTech. So essentially, there's also a problem of media. For me, I blame the media on that, right? And so, to some extent, our own ecosystem, because we should be trumping that. The biggest tech exit so far is $587 million BioNTech buying a British-Tunisian startup called InstaDeep, AI machine learning for healthcare, among other subjects. But everybody's thinking fintech, Stripe, Flutterwave, et cetera, et cetera. So there's also that maybe a more collaborative work around positioning healthcare as a investment continuum or impact continuum regarding that information.
I mean, I'm going to ask one last question and then turn it to the audience because, I mean, I think we can be talking for the whole day. So the African Development Bank, I know you mentioned the Innovation Lab, and I know you're doing a lot of work in also thinking how you can innovate both vertically, but also inside of the health system, health sector. Can you talk a little bit more about the future thinking, why the health segment as a segment is so important, and what the efforts are going to be there in specific compared to other sectors like fintech and so on?
Yeah, Lucy, I think, let me give you a little mandate side of the bank. We have a high five strategy, which is integrate Africa, feed Africa, power Africa. There is another one, change life of the people, where we fall under, health, education, water, agri, these are the segment, we are part of that. Now, what we have seen in last 3 years is that if the healthcare systems are not strengthened, the roads, airports, industry, nothing will work. That's we have seen. So I think from a development bank perspective, our role is to work with each and every stakeholder and provide financial support, provide facilitation in terms of the policies, in terms of the mobilizing different stakeholders, partnership, both on the capital side as well as the building a kind of an environment for public-private partnership. I think that's the key. If you're talking about impact, we are driven by the impact across the society. And that's where we want to bring both public, private sector, because I think the demand is huge. Numbers we are talking about, if I give you a ballpark number, the African GDP is about 3 trillion. And I think the government have to invest at least 10% of the GDP, ballpark number, 300 billion. Now gap, I don't know how much would be the gap, more than 200 billion, I don't know. So that number is crazy, and that cannot be filled by anybody. So only thing is that how we can work together and play a critical role in the whole value chain, either the policy side and the funding side.
Thank you for kind of like closing at least my questions on my side. I like to say that the motto almost of the HealthTech of Africa is breaking the silos, in case most of you don't know that, because we like to work together, and this is why all these people are also here and part of this. Turning into the audience, guys, what questions do you have, and for who? Please present yourself, short in the organization, and ask your question. And to who do you want to ask the question, ideally?
Thanks.
No.
Now? Okay. Mehreen, I work at the Global Fund. My question is to Jazarif Ventures and African Development Bank. I think when you Google innovative financing mechanisms, you come up with a range of very creative instruments like social bonds, green bonds, blue bonds, orange bonds, and also blended finance. And so that's all really about creating financial incentives and transferring risk. I would be curious to learn your perspectives on whether you think these instruments can really help create financing mechanisms at scale for digital health and really provide the financial incentives to bring partners on board, whether it's impact investors, whether it's governments and Rwanda and others as well. Thanks.
Thank you very much, Neil. So from a Jazarif perspective, I would say it's crucial. So one of the things that I've seen in the previous life is that when you have a typical blended capital structure, there's a part of the capital structure that helps you de-risk some of the early stage risks so that more impact or commercial investors can come in. My experience so far is that in the healthcare sector, and digital health in particular, I haven't seen that many functioning models around it. One sector and one slightly different angle to the blended capital structure I've seen is, as a former director of ACF, Africa Enterprise Challenge Fund, I used to manage $360 million, half of it in agriculture, the other one in renewable energy, where we were providing zero interest loans or technical assistance to companies. And we used to say we're starting a race and then commercial impact investor will really continue and win it. The idea was to say, provide these instruments for a hordes of startups to create using those instruments to de-risk their operation, set them up, processes, etc., so that down the road, other companies, other investors, public-private partnerships, etc., take them forward. So that's another instrument. Now, one of the things that I've been toying with as an idea is to say that digital health cannot work without electricity and internet. So therefore, one of the things I was saying is that if you can figure out a mechanism where we bring that as a package to healthcare facilities, even in a rural area, in a public-private partnership model or project finance model, that will help. I'll give you a very simple example. About 6 years ago, there was a totally, I found random project between Samsung and the Ghanaian government. I'm Ghanaian, so I've been going around, and what I realized is that they took a 40-feet container, put batteries, a water treatment system, solar panels, and dropped it in a village, right? And what they did is, with that container, they also had a school powered by the solar, and a healthcare facility also powered, right? It was one of those ideas that I found quite innovative in trying to bring both energy, internet, healthcare facility, and actually a digital school, I forgot. There was a digital school with chairs, etc., within that framework. I'm not sure the container is the best idea, but I'm thinking if healthcare facilities can get access to internet, renewable energy, that would already create a lot of infrastructure for digital health to come on board. Right.
Arun, thoughts from you, and then Ashley?
Arun, yeah.
Okay, I think it's very important. You know, the blending of capital is very, very important. As Steve mentioned that, you know, some of the donors, their objective is that this capital has to utilize for the development, right? Because their mandate is very different. Whether capital comes or doesn't come, that's a separate issue. Now, then the next pool of capital is the development partners, where they said, okay, we need to look at decent returns, you know, not like 50%, but at least let's say because we have a fiduciary responsibility to our stakeholders, the government across the globe, so that there should be a decent return, not only for us, but also to ensure that there is a sustainability of the operation. If the project is not making a decent return, then the project will be closed. I can give you so many examples that we built one institution, education center in middle of Central Africa. And after 3 years, 4 years, when we went there, there was a pigeon house. So because there was no healthcare, or let's say no teachers, there are no operators, because nobody was managing the energy side of it. Nobody was managing the curriculum. So that's why the partnership has to be there, public and private. It's very, very important to have an efficient operation of the project, at the same time impact. That's very, very critical. Now, there is one of the interesting fund, Steve, I'm sure you are aware of it, Transform Health Fund. That fund they are going to invest into the PHC, primary health care, and the tech also. And they have an interesting structure. They have a donor pool, which is about 35%, and the 65% is the commercial and development pool, meaning that the development partners or commercial partners will have a normal return, but the donors, that's the kind of a buffer, that's totally grant, and that will be used for doing the development work, even the feasibility study, all those things. Now, there's one point I want to mention that as a bank, we also provide grant capital, but that has to come with some specific project. Grant is very limited amount, and that could be utilized either doing a feasibility study, either doing E&S assessment, because we are driven by, the impact is going to come if you are aligning the project with the national standards as well as the international standards, and climate change is one part of it. E&S, I said, feasibility studies, if your capacity building is very, very important for us, because if you are building a healthcare facility or hospital, whatever, if you don't have doctors or nursing staff, hospital is just like a real estate building. So the capacity building is also important piece. So we look at utilizing those resources in a broader development outcome for a project. Yeah, thanks.
Thank you, Arun. And on the piece on climate, I know, Ashling, you are working quite a lot on that. Do you want to share some words?
Maybe just to first of all start with, I think Steve's point around the importance of parent connectivity as enablers of digital health. I'm really glad that you brought that up, Steve, because I think too often we have a lovely discussion on digital health and solutions without assuming that the environment is electrified and connected to the internet. And we know that that's not the case in probably more than half of health facilities, right? So, and we're also learning this. So in our next catalytic fund that I mentioned is going live in January, we're going to have an intentional focus as part of the digital health fund in investing in last mile parent connectivity. I think, if we look ahead to what else is going to be needed in the future, undoubtedly we're going to need to scale and increase the funding for this infrastructural layer. And I think this is where blended structures become really important, because at the end of the day, you're not really going to fund parent connectivity at scale on grants, right? So this, for me, is where institutions like the African Development Bank become really critical, and this is where I think we have an opportunity to really take investments and investment funds for digital health to the next level, and also to break down some of the silos, because it's not digital health for digital health's sake. It's digital health for health. It's digital health for climate resilience. So what does that look like? There is so much climate finance available, going into, again, quite siloed areas that relate to what are perceived to be typical climate investment areas. But the link or the role of data and digital health in mitigating and addressing the health impact of climate change is massive. So I think it's one of the things that we're starting to think about as the Global Fund, and as we think about the intersection of climate and health more broadly, what can we concretely do, and certainly how we can leverage data and digital tools to respond to the impact of climate on health today is one. But we have to take that beyond talking about it and the narrative, and we have to start embedding it into how we fund. So again, my call to action for my fellow panelists and all of you in the audience is, please help us think about this, because we do want to shape our next digital health fund with the kinds of people who are in this room. This can't be a Geneva top-down fund, right? So we want to build from the bottom up, and so Maureen, you've met earlier. Please come and talk to us, and we'd love to see how we can shape this together.
And I really want to support your message, because also us, the Novartis Foundation, and our partners from Microsoft AI for Health, we spend quite a lot of time working around the connection between health and what we call social determinants of health, which could be climate, where are you born, what education level do you have, what kind of transportation methods are you using, what's the role of the environment. And all of this is impacting your health outcomes at scale. So for us, it's not just a question of funding, it's a question on the end quality of health, access to health, and in the end of the day, how do you drive systemic level change? So absolutely quite a lot of valuable comments from everyone. We have a time for one last question, and then we go for a coffee. Now you have to fight. No. If you keep it short, then maybe take both of them.
Hi everyone, Natalie Marisic from Alderay, and the words ROI and impact have been used quite extensively. So I'm curious, from the perspective of the funders, how exactly are you defining what impact is in alignment with your beneficiaries? What processes, what monitoring and evaluation frameworks are you using? And certainly, how are you working with the beneficiaries of your funding to enable them to demonstrate that impact, in that they know that they're doing it, but they're not necessarily able to show it?
I think that's like the $1 million question, which probably will take 1 hour from everyone, but please give 2 sentences, each one of you, because we don't have the time. Steve.
For me, it's very simple. We have a triangle, we look at the breadth of impact, how many people are going to be essentially provided the service that improves their healthcare, number one. So breadth, number. Depth of impact. So for one person, we do the primary care, fine, secondary. If they have a genetic disorder or mental health problem, that's the depth of impact. And those two dimensions, how do they grow over time with our intervention? So depth, breadth, and growth. Simple.
On the how and the second part, I think you have so much time during the coffee. So please comment from the others. I'd love to hear Dino, Arun.
Yeah, I think in addition to I think what Steve mentioned, we look at a stakeholder wise. On the beneficiary side, meaning that how many number of patients the project is affecting, number of in a year, in 10 years, let's say how many patients are going to support. That's the first point. Now, second is how many jobs are creating with the investments. Let's say if you are putting 100 million, how many jobs are creating? That's very critical. In jobs also, we have three segments. Youth jobs, which are less than 35. Gender balance during construction, during operation. Now, the third piece is about if you are putting 1 million, how many dollars we are able to mobilize. That's another piece. Now, fourth piece I would say is government, because government is also part of the shareholder in this. So how much tax is generated for the government? That's very, very critical because we have to see that part. Now, one of the last part is that monitoring and E&S. See, end of the day, our role as a bank is not going only funding it. We want to make sure that how we can make this company as a world-class company in terms of E&S, monitoring, reporting, because that's the key where a lot of companies are lacking behind. So I think these are the key focus, and this is Bible for us. If this project is not qualifying these criteria, I don't even talk about that project.
Thank you, Arun. Any last additions from Dino, Alex, Ashlyn?
Just briefly, I think it is a problem. I mostly see people measuring outcomes, not impacts, when you talk about digital health tools. And I think you need research budget and support as startups to help with impact modeling to make a case for your tech. And sometimes you don't have budget to fund that or to do it. So that's another challenge.
Nothing.
I think with us, it's simply lives saved, right? And then there's subcategories, I guess, of how we measure that. It's how many people are, get bed nets and are saved through those bed nets. How many people are put on ARV treatment and live as a result. How many people are identified and get on TB treatment. But ultimately, it's lives saved.
And in case you want to know about the actual hub program, for us, the top line criteria always remains the beneficiaries. How many lives have our startups and scale-ups touched positively through the initiatives? And when you drill down under each one of them, you have different impact evaluation metrics, right? These are top line. The second, jobs created, because we strongly believe that health and technology is the new era of jobs that we have to fill by 2023, and we would have so many people looking for jobs in about 7 years from now in Africa. The number of public-private partnerships and new policies influenced, very important for the hub. And last but not least, amount of funding raised from our guys and girls. Last question. No? Last question from the gentleman.
Thank you very much. My name is Richard Kalunji from Kampala, Uganda, where I run a social enterprise that is into home medical care and digital health to address the gap on health information and diagnosis and treatment. I think this is to Ashlyn. We're seeing two sides of the coin. For any entrepreneur in the room that has pitched before, if you have a panel before you, they will ask you, what is your success looking like? Where are you coming from? Where are you going? How much do you need? What are you going to use it for? And on the other side, we see governments, which we must really wait up for until they think the way we're thinking. So in this perspective, what does an entrepreneur do? Because there's that big target that we're trying to achieve, eradicate malaria, eradicate TB, and entrepreneurs are innovating towards that goal. Do we have governments thinking towards that goal as well? And how does the entrepreneur work or strategize in this time, perhaps until governments start to think like them, or until Global Fund starts to work with the private entrepreneurs, or until Global Fund meets the gap between the entrepreneurs and the governments? Thank you.
It's a great question. I would say that I think an entrepreneur needs to solve for what they think they can solve for best. And I think you need to solve for, you need to be very clear in terms of what is the pain point you're solving for. Because the clearer you are about the why and the what and the how, I think you'll attract the funding because your pitch will be clearer to the investor. And you will identify a fit or not, right, with, or how you fit into solving the problem for the Ministry of Health or global health player. But I'll be honest, I've had the privilege to be exposed to and have met with a number of the entrepreneurs in this HealthTech hub over the last kind of year and a half, 2 years. And I think one of the things that strikes me most is that I feel that sometimes entrepreneurs are trying to understandably mold their value proposition or their solution to follow the funding or to align with the funding that's available. And I can understand why that's the case, but the result is that when you pitch to a funder, the funder is not really very clear at all about what is the problem you're solving. And so you end up having kind of a bit of a futile dance. So I think it's about being very clear about the problem you're solving, but then how you tell your story can change, right, or it can shift. Your narrative can shift, and I think this is where the HealthTech Hub Africa plays a really important role, because as part of the platform, in my view, is also to help with the translation, right? So I don't think an entrepreneur should be adapting necessarily and waiting for government to understand their value proposition. I think it's the other way around. And that's part of the role that the HealthTech Hub can play in helping both parties to understand each other's language, but ultimately for the entrepreneur to be able to speak the different languages that they need to speak, because but ultimately your value proposition, I don't think, should fundamentally shift unless it's an intentional pivot, because you've seen that actually what you thought was the problem is not actually the problem, and this happens a lot, right? So you're going to pivot and you're going to solve for a different challenge, but then be clear about what is that problem that you're solving for.
Thank you so much. And with this, I guess we have a couple of key messages. So the role of public-private partnerships, different roles within the ecosystem, and not only interoperability between technologies, but between funding sources, between funding mechanisms, goods, needs, to solution matchmaking, and the right kind of convening platforms so that actually the needs could be channeled, but also the solutions could be channeled, and the right kind of enabling regulatory and policy ecosystem, and probably more messages that I kind of forgot, but we'll be able to discuss over coffee. So thank you so much to all of the panelists. Thank you for the contributions, and to all of you guys for these wonderful questions. So I guess with this, we're going for a coffee.
Yes, we have a health break now, but I'd like to tell all the startups in the room, kindly look for Christelle. She's standing right there. She has some briefing notes that she wants to share with you. Let's all meet here in the next 10 minutes for the next panel discussion. Thank you. College in New York City in the US and completed his medical training at the MIT General Hospital in Boston, where he was a clinical fellow at Harvard Medical School. Our next panel for today, we have Dr. Nelson Igbiriki, CEO, co-founder, MedTech Africa. Dr. Nelson, if you could come to the stage. There he is. Nelson is a biomedical engineer with 8 years of industry experience in radiology, cardiology, and oncology medical devices, with focus in Nigeria, sub-Saharan African countries. Prior to MedTech, he was among the technical team, lead of an extensive team at radiotherapy and cardiology engineers, and managed over 250 projects across over 85 hospitals in sub-Saharan Africa. And our moderator for this session is going to be Natasha Mugeni, Digital Health Director at Y Labs. Round of applause. Natasha, over to you.
Thanks, Fiona. Hi, everyone. I think we just heard a lot about experience from the investors. It's about time we hear from the recipients. So this could be a nice tete-a-tete. So I'll start with you, Robert. Can you share more about what Penda Health does, and especially in digital health?
Good morning, everyone, and super excited to be here and be with all of you. My name is Rob. I'm a primary care doctor, and I'm the Chief Medical Officer of Penda Health. So Penda Health is a network of primary care outpatient facilities in Nairobi. We have 18 branches around Nairobi, and we directly provide primary health care to over 1,000 people every single day. I think you heard from my colleague, Dr. Sarah, this morning about how we really try to put the patient at the center of everything we do. And of course, we use technology. Technology we really use to drive improvements in our business model, to try to improve quality, and ultimately to drive greater impact for the communities that we serve. So I'm super happy to tell you more in depth about some of our technology, which I'll be doing later on this afternoon, but let me leave it there for now.
Thank you so much, Robert. Nelson, what does MedTech do?
Hello, everyone. My name is Nelson Ibiriki, a biomedical engineer, as mentioned. My key experience around medical devices in hospitals, helping hospitals handle their cloud infrastructure, connected medical devices in cardiovascular care to radiology and radiotherapy, CT scan, MRI, and happened to be the CEO and co-founder at MedTech Africa, where we build a solution to be able to manage patients with cardiovascular complication. So we run a healthcare software that enables patients to be able to monitor their health through connected wearable devices, your Apple, your Fitbit, and for this data to be able to share automatically in that format to their providers. And we are focused on the data-driven part because we understand a lot of information are lost. Let's take, for instance, a patient with stroke and hypertension. He monitors or she monitors her blood pressure morning and evening, and this is a vital information. The doctor should be able to see the changes in their heads daily, and this data is not available. For instance, you take a look at Samsung or maybe Omron, which is not enabled in Africa. So if you use an Omron device, you have to print out as PDF and send to your doctor. It means a different records separately somewhere, and this is the most vital information your doctor needs to treat you to recovery. And this is what we do. We bring the data directly to the doctor and force adherence. So we provide third-party reminders for elderly persons, for their siblings, or maybe their children to be able to remind them when to take their drugs, when to take their medication, to be able to help them recover faster. And on the hospital end, we provide an in-depth software to be able to help analyze this data. To one, prediction, two, emergency warning. So you see the growth changes, adverse changes in health. You can be able to alert the physician, alert the patient to be able to provide intervention. And this is very key. If you look at the Nigerian market space, we have over 100,000 deaths yearly as a result of cardiovascular diseases. And in the last 4 years, the record released by the Nigerian Heart Foundation shows 20 million persons were hospitalized because of uncontrolled hypertension. It means intervention has to be placed in place for them to be able to track these changes in their head and ensure it doesn't get to the end stage, because the cost for recovery is over $6,000 to treat care in Nigeria. It's very expensive, and we provide a preventive means and also support through the way. And one of the key things, I will also talk about one of the things we work with the Novartis Foundation, the project we run currently called the For Cardio Play for Health. Now, if you look at the data in Nigeria, in 1997, we have less than 1 million persons with either hypertension or diabetes. Today, we have 80 million. So from 1997 to 2023, you could see an exponential growth. So something is actually wrong. Maybe diet. So the answers we are working with the Novartis Foundation and the HealthTech Hub to be able to answer with schools and with the Federal Ministry of Nigeria. So we partner with the Federal Ministry of Health or the Federal Ministry of Education to be able to provide awareness, screening, introduction of nutritional cardiovascular knowledge into the school curriculum. And we're working with state governments to be able to achieve this, because there's so much you can do in the intervention part, but there's more you can do in the preventive part, because by 2030, we expect at least 100 million Nigerians, which should be like 45% of the population in the country. So that's one of the things we're doing with the Play for Health project currently in Nigeria, focusing, targeting over 120,000 students in secondary schools, actively participating in exercise, learning about nutritional health. We have to look at our diet, because it's showing a high indication of what is causing these changes in cardiovascular complication in our country. And we're looking how to get answers. And we don't just work with the government, we work with international partners. For instance, in practice, we're working closely with the University Hospital Basel to go into more in-depth research. We're working with a government institute, the Institute for Child Health in Nigeria, to get these answers and push this. And I know a lot of persons are asking, how are you going to make money from this thing you're doing? Now, it's simple. If a child is obese, there is a possibility and there's a high risk that some persons in the family are having the risk factor. So beyond just screening the child, we take it down to the parents, the family. So we're building a family that also knows their health status and also help them plan their diets and also help them monitor their health to recovery. So it's like a comprehensive suit where parents will pay to get screening for the family and also get palliative through the way to recovery. So that's it to me. Thank you.
Thank you so much. I think you just highlighted some of the issues that as a continent we're facing, such as the exponential growth in NCDs. And I think some of us are sitting here to just actually looking at the solution and see what can we do. You are both recipient of the funds from the Africa Tech Hub Africa. Can you share more about what these funds supported and were they different from other typical funds that we know? Starting with you, Robert.
Yeah, and I think I have one slide that just kind of shows at a very high level what we're doing. But one of the main problems we've worked on at Penda over the last 10 years has been on healthcare quality. And again, I'll talk about that a bit more this afternoon, but it's really a major problem. And the poor quality of care that's often given in our ecosystem is making a lot of people waste their money. And that money is basically being spent on tests and treatments that are not helping them. And we think that that's a huge problem. And so what we've been working on is really how do you improve quality? One of the first things we did back in 2017 is we implemented a cloud-based electronic health record across all of our clinical sites. And so that's been in operation now for almost 7 years. And I think that's really the first key step to improving quality. If your clinical care is not digitized and you're at any level of scale, it's very hard for Dr. Sarah or myself to really answer the question of how good is your quality. We would have to go through and find those medical records and open them up and look and really see, are vital signs being recorded? Is the right history and physical examination being done? Are the treatments matching the clinical guidelines for that condition? So I think just digitizing is a very, very important step. And the other two things on here, which are rule-based clinical decision support and then a generative AI approach, which is what the HealthTech Hub Africa has funded for Penda, those are really fun and exciting steps, but they're honestly less work than just digitizing. And I think everyone here, I would love for everyone to really internalize that, because when you think about the capital expenditure of making sure that you have the devices in order to actually capture the digital data, and then the change management, the behavior change is massive. Penda now employs about 400 people, and to have 250 or 300 clinical staff move from writing things in a book to doing something on a computer, it's a major, major change. So I think it's important that organizations don't see dropping tech as something that is all focused on the tech and not very focused on the change management aspect. And it's even things like typing. If you want to have good clinical notes, you need to have at least some text there. Many of our staff are very slow typers. We're talking like less than 10 words a minute, which means that if you try to implement something that involves typing, you're either going to need to spend a lot of effort upskilling your staff, or you're going to need to slowly sort of escalate your workforce over time to do that. So I think that second branch there of just digitizing the clinics was the biggest lift for Penda in terms of resources. Then we went to rule-based decision support, which is essentially, and I'll again show you this later, but if the clinician makes a diagnosis of uncomplicated malaria, there's going to be some pop-ups that say, do you want to give artemether lumefantrine? Do you want to give paracetamol? And then you can just approve or reject those options, and it makes doing the guideline recommended thing the easiest thing, and it puts that right in the clinician's normal workflow. So that's one of the main ways we've tried to improve quality. And again, that's a major cultural shift, because you need to get, again, the hundreds of clinicians that you work with to really accept a recommendation from a computer. And that's a major shift that we need to give the right amount of resources in order to make that change. We now have clinical decision support for over 300 different conditions at Penda, and that's how we've been able to bring our guideline adherence from a national average of only about 40% up to about 89% within Penda, which is more than doubling the value that we think our patients are getting when they spend their hard-earned money at Penda. So now, the very exciting thing that the HealthTech Hub Africa has funded is to move our rule-based clinical decision support into this era of generative AI. And for me, I'm not just saying this because we're here at the HealthTech Hub, it is the most exciting project that I've worked on at Penda over the last 8 years. The potential to improve quality, the potential to improve the workflow, and sort of the day-to-day work of the clinician is really, really massive. And it's something that I'm excited about, our clinicians are really excited about. And if I can just add one more thing tongue-in-cheek, if you put this image in your pitch deck of this head kind of exploding, investors will just write checks. So if anyone wants this image at the end, let me know.
Thank you so much. Nelson.
All right, so what we do with the support from the Innovatis Fund, I already mentioned some part of it. Support from the Innovatis Foundation is to be able to reduce future complications as a result to cardiovascular health by addressing it today. We focus closely on kids. If you could please put on my slide 3. We focus on kids projects. I mentioned closely that in Nigeria there is a deficit of knowledge, and which is as regards our diet, as regards our way we do physical exercise, and that's one of the key things we're doing. We're trying to instill healthy habits into the healthcare and educational system in Nigeria. And one of the key things since we started working on this project, now this is the first in Nigeria, nothing has been done on kids as regards NCD in Nigeria. So when we approached the Ministry of Health and said, with the support of the Innovatis Foundation, we're doing this project, they said, oh wow, this is the first of its kind. It means you have to do a lot. And we had conversations with the Ministry of Education, and I said, let's look at the curriculum. What's available on the curriculum? In fact, nothing. Even the director in charge for child health, he screamed. They were like, "Ow! See where the problem is coming from. We have no knowledge about how to take care of our heads. And our kids are not empowered with the knowledge. And that's what we're doing with this project. We're seeing how can we instill healthy options for them. How can we be able to help impact-driven approach. And we're not stopping there, just the knowledge. We're driving the data part because we're doing collection of some samples, or BMI, or check for obesity in the population, just few sampling, with the support of the Ministry of Health, to be able to use AI to see what's happening in our population, just by zip code, by location, is it by status of the parents, are they middle income people who are highly obese or highly diabetic? These are the answers we're trying to look for while we're working on this project. And one of the key things about the Play for Health project is that we have an opportunity to change the course of the healthcare in Nigeria. And that's what is exciting for us. And that's why the project is very exciting for us. And we wanted to do the project in 4 states. But when we released news that we're doing this, we got approached from 10 states who are willing to jump on this because they understand the importance of the knowledge gap in NCDs and to be able to drive this knowledge for us. Nigeria is a very teeming young population. Over 65% are under 18. Very young population. And if the knowledge gap is not there, it's not yet filled, it means we are heading for a disaster in our healthcare system. And if we also take a look at the available professionals who can be able to provide this care, in Nigeria, the last I counted, just 500 cardiologists to the whole population. So it means, and the cardiologists are leaving. In fact, Nigeria, the healthcare professionals are running away because greener pasture in the UK, everybody's going to Canada, and everybody's leaving the country. It means we have a crisis at hand, and we have an impending crisis coming, and which is why this role, what we're doing, is very important for us. And we are not stopping here. We're taking it further. We're seeing support from other organizations to be able to take it to the university level, to be able to inculcate this knowledge. I, for one, went through the educational system. I have basic knowledge on NCD, but I spoke to a lot of my friends. Nobody even knows about hypertension, just that they don't go through medical courses. They don't even have the knowledge. And if you tell them somebody died of hypertension, they'll be like, it's not heart. Somebody's heart just swell up. That's what they will tell you. They have no basic knowledge about it, and which is what is important in what we're doing. And we're super excited for the support from the HealthTech Hub for this project, and we're looking forward to see how we can be able to change the course of things in Nigeria. Thank you.
Yeah, thanks. I think I'm going to divert a little bit and get into now more spicy discussion. When you're applying for funding and investment, there is this question they always ask about scalability and sustainability. And so I want to hear from you, Nelson. Do you think, especially as a startup, growth and scalability can coexist together in the household?
I think they can, and I think it depends on your business model. As an entrepreneur, I'll be very real. If you have a premium product, you will focus on profitability. But if you have a product that needs a lot of users, right, you want to get a lot of users, you might not be able to charge the money, and your break-even will not be early enough. So I think it's for entrepreneurs to look into their business model. What are the things they are looking for? Do you want a lot of users, right? Or you just want to target some private clients? And if you're focusing on that, that means you're focusing towards profitability. You're saying, let's say, for instance, I would give a reference to a company like Flying Doctors, where they pick up people who are sick, premium clients, they fly you abroad on a private jet. And for them, profitability is easy. They broke even, I think, 2 years. You wouldn't compare them to a company like Helium 8, which is a very big EMR that has not broken even, because they are trying to reach more people. And that's where scalability comes in, working out with partners, see how we can to partner and look at. So I think I would see it from that point of view. I know Rob will have a different point of view, but I see it as that point of view because as a business person, you have to look out for your interest of the business and your business model. Because when speaking to investors, they want to make profits, right? But if your product, it's a product that you require to reach a lot of users, you might not get the profit in the first because you have to drop the price. But if you have a premium project, you can get your profit, you can focus on profit. So.
Robert, what do you think?
Yeah, I think the tension between growth and scalability, and I think by scalability we really mean profitability of the company, is one of the most difficult strategic decisions that we all need to make as entrepreneurs. And I think it depends in part on the funding environment, and I think it depends in part on sort of where you're at as a business and how the ecosystem is. But I can tell you a bit of the story of Penda, which over our 11 years, we've raised almost $10 million of mixed funding. That's equity, VC, impact investors, debt, and grant funding. And we wouldn't be where we are without a mix of all of those. In the early days, there was a lot of focus on growth. Once we sort of had a branch that was functioning and we had patients who kept coming back, there was a lot of money to grow. And we grew up to like 22 branches across Nairobi. And back at that time, if someone would have said, well, what is your operating margin of your clinics? We would have been like, not sure exactly, but we can tell you our patient numbers. We can tell you our revenue. We didn't have a lot of business discipline. This is back in sort of the late teens, 2018, 2019. And we were poised to continue growing really fast. In 2020, we were raising around. And in March 2020, like probably for all of us who had businesses that were functioning at that time, COVID hit, and it completely upended everything. Our costs more than doubled overnight because the cost of supplies went up. We were getting our staff to take specialized vans home because of the curfew in Kenya. That was massively expensive. Revenues fell by 50% because people weren't coming in as much during the COVID period. Lockdowns, economic uncertainty, and so forth. So it was really disastrous for Penda. And of course, the funding environment also really changed at that time. So we had to basically completely shift where we were on that spectrum between growth and scalability. And we were forced to really, really tighten the bolts on really understanding exactly what our labor model is, exactly what our COGS percentage of revenue is, our OPEX percentage. And we spent basically 2 years nailing those things down. And it was things like our leadership team going into branches and checking, how many nurses are on shift? Why do we have 3 nurses on shift if this is a branch that's seeing 30 patients a day? That's not right. We need to give warning letters to make sure that, that staffing model is always exactly optimized. And so that was an exercise that built a huge amount of business maturity for Penda. And I think if the environment had been different, we may not have had to go through that. Now that we've gone through that, it's now one of our most valuable assets, is we now run a much more mature business where we understand our unit economics. And have we grown? No, we have 18 branches. We've closed a couple because of that focus on business maturity. And when a branch isn't performing, we have to close it. So I think we're now starting to shift back into growth again, and part of that is how the funding environment is. Part of it is now we've really proven this kind of network level profitability, and so it's allowing us now to be positioned for growth again. But I think these are things that every business is going to need to decide by looking at the funding environment and looking at the ecosystem. Where are you on that spectrum?
Thank you so much. I think most of us can relate when you realize that actually you're bleeding money and you need to really having those tough conversations around, starting thinking about the road to profitability. But then you highlight something around the mix of capitals. We have donors, we have investors. What do you think really works best for digital health solutions? Is there one that you can think of, or is there a mix, and why?
Yeah, like I said before, all 3 have been crucial for us. We couldn't have done it without the mix of all 3. We're more of a hybrid model. We started with brick and mortar, and now we do quite a bit of digital health, including like directly to the patient over chat and phone and things like that. But the core of our business is still in person. And I would say in general, VC and donor funding does not like to go to brick and mortar. And so debt is a really key player if you have any brick and mortar facilities. And what they want to see is they want to see that that model is de-risked. I would say donors and VCs are actually, even though they're sort of opposite ends of the spectrum, are more likely to be risky, whereas debt partners really do not want risk. They want to see that you have a very clear path, and if we copy-paste this, they're going to get their money back. And so the debt provider that we were talking to back in 2019, when they asked us our operating margin and we didn't know, they basically ended the meeting. They were like, okay, we're done. That's sort of how debt partners think. And then I think VC is very important for when you think that you can scale very quickly a digital health solution. And I think donor funding is really great for when you're taking a big risk either to further develop a technology, to further increase your impact, to reach a new population, maybe a more underserved population with your existing offering, maybe to enter a new existing, a more risky market, maybe to add to one of your offerings, maybe you want to bring in a new sort of healthcare vertical, a new device. That's where I think grant funding can really play a big role. But what I would say is only use grant funding to help further your traction. It's okay if it doesn't work, but don't just keep going down a grant-funded road that's not working. It's meant, we're all here because we're trying to build sustainable businesses. And so if people aren't paying for it, or if there's not a clear route to how that's going to be profitable, it should stop, in my opinion.
Thank you for that. I can see some fellows entrepreneurs in the room nodding their heads. So I think that's a good one to note. Nelson, what do you think?
When we're looking at the mix of the funding, we have to start from the basics, right? As a founder, I think the first fund is your money that you put in the business, your money. So when we started, my co-founder and I, we said to ourselves, this thing we're building, right, is this something that will scale? We spoke to a couple of persons and they were not buying it. And they said, okay, we need 20K, you bring 10K, I bring 10K, and we'll put the money. The business failed, right, at a point, but it gave us skin in the game. We weren't under pressure. And I think there's also another part, accelerator, which is the HealthTech Hub Accelerator. And I think I appreciate what they're doing because a lot of funders do not have the basic knowledge about what funding is and when they need it. And if you go through like an accelerator, they tell you, okay, this is some VC jargons. For instance, some VC, they tell you, what are these metrics? Where are these? You don't know them. Most of us don't know them. We are not in VC, right? And I think that plays a key role in your early stage, getting accelerated so you can be able to get access to people to know more about your business. And if we're in the area of VC money, and I think that's for scaling, right? I think it got to a point when we were building, we said, no need to approach any VC. We just shut down because we knew from our margin that every time we approach a VC and they are looking for scaling. How? Because you've not been able to prove what you're doing, or you've not been able to show a lot of traction. So we said, okay, let's hit back and grow our business with our money from customers' money. So, and I think one of the key parts in the healthcare space is that we're not really focusing on customers' money. And I think it's one of the key parts, if customers can fund your business. And I think I would remember during, because I was part of the last year HealthTech Hub cohort, and they invited somebody, one of a founder in the healthcare space, and he told us, shared an experience on how the first fund he got for his business was his customer that paid for 5 years. And as at that point, I saw more reason, because I had a network of hospitals. I knew the MDs. So why can't I go and meet them and get them to pay for this product upfront? And it actually changed the way I view funding, right? I wasn't too much focused on chasing VC's money. I was more on focusing the real metrics. Let the customer pay for the product, right? So, and I think that's one area a lot of funders need to look into. And if you focus more on your products, you get your distribution right. Because healthcare, we have a terrible distribution. We want to digitize the whole process, right? And you forget that the people in Africa are not yet digital. So you get the value gap. So, but if you focus on that metrics, on your customer paying for your product and generating revenue, you should be able to clock that out. And for donor, I think donor comes in place when you want to experiment. like Bob Roberts mentioned, when you want to try a new product, right? When you want to try a new market, because you know you're not under certain pressure, because VC wants to see results. You have to send investor update every month, and it's not a funny thing when you don't send it. And I think it's good we're having this conversation. And I want to say something around this point. The healthcare space, we're having bad PR, terrible PR in regards to funding. And I really think we have to look at that, right? We have a lot of positive news, but in the healthcare space, all the funding news you've seen for the past 3 months is either 54 genes shutting down, taking away VC's money. And that's what's on the headline. A lot of funders like Rob, a lot of amazing funders here are using the right money, right? Are using the VC's money. They are doing the real work. But what is out there in the news is just negative press. And fintech is enjoying it. I don't know. Fintech, despite somebody taking 50K per month, which is very ridiculous, they still get good press, right? And it's very bad, and it's giving this sentiment with VCs, right? A lot of VCs, if you look at this year, the funding that coming to startups has dropped in healthcare, right? Last month, we are having a conversation with some funders, and it's just like 3 startups in Nigeria that have raised funding. Compared to last year, by this time, we've already raised over $500 million. This year, nobody's jogging around 100 million. It means something is wrong somewhere around the funding gap. And I don't know, maybe it's where policymakers can be able to help us, right? Because some of us are doing the real work, right? We need to push it out there, because all these things helps in the credibility of the businesses in Africa, which is why most people are seeing African businesses as charity, the healthcare systems as charity, as people who don't make money, who don't make profit, because they see, that's what they see. It's perception, it's a perception-based industry where we live currently. And I think as founder, we have to be careful with the funding route we take. A lot of funders get burned with the kind of money they take. For instance, as Rob mentioned, you know the stage where you are, right? You have a product that you've not tested in the market and taking VC's money to go and be testing a product that is not yet tried in the market. You'll be under so much pressure to deliver. You see, so I think a lot of funders need to look at where they are, see the funding that suits them, right? If you need to get grants to be able to do this, go for grants. If you need to put your own money, go for it. And I think one of the early stage, I got my friends to put money. You cannot be hailing me, chairman, you're an entrepreneur, and not put money into my business. So I got there, I told them, like, hi, I'm raising F&F, family and friends. I need your money. Pull this money, pull this money. And one of the key things I had in my early stage was my boss, who I was working with. So when I left the company, I told him I was going to start my own company. And he had heart attack, and he was rushed to the hospital that day. And the next day, he called me and told me that, I'm going to write you a 5K check. I was like, what changed? He said, you're building the right thing. And I have been talking to him since. I never asked him for money, but it was something that they could buy in, the family could be able to bring. And that helped us when approaching some investors, because they see you have skin. You've put your money. Your friends have taken the risks on you. You've gotten some little bit of traction, right? And you've, of course, gotten partnership with the Novartis Foundation. And I really think donor help a lot, right? If you get funding from the credible donor. Now, I will give a scenario. There's a hospital we'll be trying to close, a very big one. It's not a cardiovascular hospital, but a very big one. And we'll be talking to them for the past 6 months. But when the Novartis Play for Health Fund came in, the MD saw the news and sent me a message like, oh, if Novartis can back you, it means you're trusted. And that was just it. And we onboarded them. So donor can play a big role in the perception game and give you a little bit of credibility, because these are, if you get funding from the Global Fund, this is a big organization for them to trust your money, because the thing about healthcare is that doctors don't trust us, because I see where the problem is coming from doctors. We're having issues with doctors. They don't really trust us per se because they know they are dealing with patient data, right? So it takes a lot of convincing to build that kind of trust. You're an EMRO company and you're having all the data of his patients. What now happens if you sell it and lawsuit comes in? You see the issues in the US with patient privacy and issue. Everybody's afraid, right? So it takes a lot of trust, and I think donor helps a lot. There's VC can open some door, but public perception, donor money, actually helps a lot. And also opens you with great connection. Even if you are doing B2G, governance business, it opens door for you because they are more willing to listen to you. So thank you.
Thank you so much. I think you just reminded me. We were closing Series E funding, and I went to this meeting, and in my head I was just thinking about impact, because from a health perspective, that's the only thing I knew. And I remember they talked about OPEX, and I was like, and they asked, what is your OPEX? And I don't even know what OPEX was at that time. I didn't even know what Series E was and Series B. So I think that's something that, as entrepreneurs, we need to really think about. We need to be informed, because most of the times you enter this industry and don't even know how the journey is going to be. So we need probably to document and be able to share with, especially startups. I think earlier on in the panel with investors, they talked about some of the key things they look at when they're looking for a solution, an innovative solution that they're going to fund. And I think these past few days we've been hearing a lot about, we are at a point where we don't want to see just good solution. We want to see really scalable, impactful solution. My question to you, Rob, is what do you think should be, if I'm an investor, I wish I was, what should I look at? What is the checklist? What are the things I should look into? Apart from the job creation that we had earlier on, or gender lens, or anything related to what they mentioned, what else do they really have to look at that you feel like they're missing maybe?
I feel like I'm beating this capitalist drum here on the stage when answering these questions, but I think it really is about, is this a sustainable business model? And the reason I keep bringing that up is because I having now spent about 8 years kind of seeing companies come and go in both the digital tech space, digital health tech, and just the physical space. When a company doesn't have a sustainable business model, it's very highly disruptive to the rest of the ecosystem. And I'm sure all of you have seen that in various forms, where a company may come in and do something that is clearly unsustainable. Maybe they're offering blood tests or urine tests at a price that is below even the base COGS of that test. And they may do it even for a long time. And when you do that, it's so highly disruptive to the rest of the ecosystem because it affects all of the other healthcare providers, the lab providers in that area, the pharmacies, and obviously it's not sustainable to do it that way. And so when that business surely changes in whatever way, either they raise their prices or they go out of business, the whole ecosystem then needs to recover from that. So I think what I would love to see from investors is that they're really looking at, on the unit economic level of what this company is offering, is it something that, even if they can't do it right now, with reasonable improvements to their business model that are actually feasible, is this like a price point and a service level offering that they would be able to do feasibly or in the foreseeable future? And that's really to both create something that's sustainable, but also to protect what is otherwise a very, very fragile ecosystem.
Thank you so much. Nelson?
I think I'll come in as an entrepreneur. I'll answer the question as an entrepreneur. And I would say one of the key things as regards to funding is your network. And I think I need to emphasize that for funders. In the early days, for like 3 years, we're chasing funding. We didn't know the right person, right? And that's one of the key things when you're trying to fundraise is you have to build your network. Of course, events like this, you meet a lot of people, build a lot of network. And as regards to what investors should look out for, and one thing I see a lot of investors looking out for, it's a lot of people invest in hype. Like this company is out there doing a lot of churn of number. And I will give a scenario of, you see, Senegal that reached almost 200 that just packed up, that were mending figures. And we discovered that they've never generated zero revenue. Because I think it really affects a lot of us as business, because these guys are putting the news there. They are paying Tech Kabar, they are paying these news outlets, they are appearing on CNN, they are everywhere, and the money goes to them, right? And the great guys doing the rough work, who are in the feed, they're doing the raw work, are not getting the money because probably they don't have the press, or they don't have the reach to get this. And it's really affects a lot of funders, the morals of funders, because between us, we know the business that are doing well. And I say this authoritatively, that as founders, we know ourselves, we know the business that are doing well, because we are the one going to the field. If you say you are doing a business with the hospital, I'm still going to the hospital to talk to the hospital. The doctor will tell me that this is my biggest supplier. And if you're not the big business and you're claiming to be this, I would know, right? It's a closed circle in the healthcare space. And it kind of dampens morale, right? When you see the funding going this way and you're doing the work and it's not coming. So I think as investors, there has to be a balance to be able to look into the metrics. Maybe more due diligence, right? Maybe more due diligence to look at it. So you're able to help entrepreneurs, because we're seeing a lot of business shuts down, or see a lot of people closing their businesses because of funding. And they are fantastic business, probably not sustainable, but we believe maybe with a little push, they would have gotten the money. Because there's this sentiment with the said company that closed, I'm sorry to use that word, the said company that closed, and a lot of people were saying that if they spread that money to a lot of persons, right, they would have gotten better impact. And it gives this kind of vibe. You're working, but you're not getting the support you need. You're doing fantastic products, you're not getting the support you need. And I'm just saying this from the perspective of an entrepreneur. I don't want to talk for I'm not a VC. I'm not an investor. So I'm saying it from the point of an entrepreneur, the pains we have as entrepreneur. There's a panel for us as entrepreneurs to see. You are the VC. You're sitting here, I will have to tell you what we feel and what we think, so that we can be able to build this ecosystem. Because, of course, the last panel we mentioned that the funding in healthcare is significantly low, less than 10% of the whole funding coming into the startup space. And there are ways we can be able to look at it to be able to improve this margin. So I think that's it.
Thank you so much. I think I'm going to open up for questions from the audience. But before that, what is the one thing you feel like should change in the ecosystem? Just one thing that you wish could change, so that we can, even that already minor funding that is available, the 10%, can be really used well.
I've grown a business that I feed, right? And I feel one of the biggest challenge with healthcare is distribution, right? We need to crack it. And I think that's the biggest problem. I've spoken with a lot of founders who have to change their business model. We have to look at distribution. I will take, for instance, a company called MoneyPoint, a healthcare. In 3 years, they have the largest share of mobile money operators in Nigeria. And what they did, that they cracked distribution. They went to the informal sector to empower these guys with the tools to be able to go to a point of pay, you withdraw your money, you don't need to go to the queue and the ATM or go to the bank to withdraw. And they crack distribution, and they have the largest in less than 3 years. And I'm looking at it in the healthcare space. How can we crack this distribution, right? Because the buzzword is there, maybe with the middle class and the upper class, but the guys at the lower level, they really don't feel the impact of our healthcare solution. Right? They really don't feel the impact. And as healthcare funders, as businesses here, we need to crack distribution. And I think that's what FinTech has done. And that's why they are receiving the money. With that sentiment, they're receiving the money because you use Momo. You take a Yego cab, you use Momo. They've cracked it. They're everywhere. Everybody's accessing it. And for healthcare is that if you don't have a healthy body, you can't go to your business. So it's something that's supposed to be part and parcel of everybody, done from the rich class, the low class, to those in the rural setting, to be able to crack it. And I think that's one thing that needs to change in the healthcare space in Africa, distribution. Yeah.
But what do you think?
Yeah, I think I would say, number one, healthcare is very local, which has implications for the potential of scalability and certainly for the speed of scalability. And then the second thing is that healthcare moves at the speed of trust. And the speed of trust is slow. It's slower than in a lot of other industries. And so I think that's part of why it's taken Penda 11 years to get to where we are. And those have been very, very hard fought years. And still, we have 18 branches today. And one of the things that we see is that over time, our best performing branches are the ones that have been around the longest. because it just takes time in healthcare. And so I think that's something that other entrepreneurs should learn from, and I think it's also something that funders of any kind should learn from, is that building trust takes time.
Thank you so much. I think I agree that especially we need to look at what does digital health means in informal settings. Earlier on, we talked about how internet is key, in how infrastructure is really important. But what other solutions are there for informal sector and people without internet? I know the mobile money folks have already cracked that one, but I think we need to think about that also in digital health. So I'm going to open up for questions. We have 10 minutes for questions. I'm going to allow, okay, there's already 2 questions. Okay.
Hi, I'm Rubayat from Endless Network. So my question was around collaboration in the ecosystem. So of course, we see a lot of startups who are each doing wonderful things, but we are seeing more and more that each of them want to control their entire ecosystem. And I think in some ways, when startups get traction, that's a curse in disguise, because they think that they can actually go the entire way by themselves. But of course, we know, because of the things, the challenges that you've highlighted very well, it's really hard to go it alone and actually do it at scale if you have to do 20 things at once, right? So how do you foster better collaboration among the ecosystem players, with each startup maybe focusing on 1 or 2 core competencies, but then leveraging other partners to deliver the rest of the value?
I can answer that. So in the initial stage, when we released our product called Focadio, it was a standalone solution. Certain hospitals were using the solution, and they were insisting, build an API to push this data to our EMR system. And we approached a couple of EMR and told them that, oh, we want to build the product into this, and they were resistant, right? And I think one of the easiest way that we had to get the hospital to approach the EMR themselves. So I went back to the MD of the hospital and told him that I'm getting resistant. Please call the CEO of that company and call us to have a conversation. And the customer was able to drive that conversation for us. And I think it's good for us to have this thing more on collaboration than competition. And I think it's something in the healthcare space. We I don't know, maybe because everybody wants to the data part, because data is oil. You don't want to share it. And I think that's where most of the people get it. So if you speak to a lot of companies, they'll be like, I can't give you access to my data. You get, so everybody's holding into it, and like, let's work together, right? I think one of the conversations 3 days ago, they raised, how can we build a fantastic product, right? A super product, wherein the solution of Penda is embedded in it, the solution of MedTech is there, the solution of Livestream is there, another product is there. So you can be able to get a comprehensive thing. And I think because of this competition, it's what is causing the resistance in hospitals. Now, because the cost of switching a product to another, it's expensive, right? So hospitals will put resistance to a new product. It's not that they don't want change, but it's expensive for them. But if the front for healthcare startups is like a collaboration, right? I'm bringing this product, but I can already plug to an existing product that is out there, so you don't need to switch between 2 products. So the cost of acquisition and the cost of using a new product is relatively very cheap for them, and they see a reason to, of course, take advantage of your solution. And I think that's one of the key things. As founders, we should look at collaboration instead of competition. Right?
Maybe just to also piggyback on that, we work with many, many other players in the field, many of them startups. We work with Rology to read X-ray and ultrasound images. We work with a AI-driven ECG company to read ECGs. We work with Baby Checker for AI-driven ultrasound. We work with Savannah Informatics to interface with insurance companies, MTIBA and CarePay on financing. So we work with many, and if there's folks in the room who have solutions that you think Penda could use, we view ourselves as an implementer, and so very happy to work with your solution. I think one of the things that we've really been looking for is supply chain, especially drug supply chain. We would love for someone to do that for us, and we've tried working with a number of companies on it, but it's really hard. and they haven't always been able to do as good of a job as even we can do internally. So I think what I would say is we want them to win. We want more and more startups to win in this space and become excellent at what they're doing so that we can outsource more and more and really focus on the core of what we do.
That's the way you say. And I think for things to be very smooth and easy, I don't know if startup can look at our company and provide APIs available of your solution. And I think Pharmaron is in building. I love what they are doing. Pharmaron, you can easily plug of medicine in Nigeria into your solution. It's within a day you plug in their solution, and you don't need to think about medication delivery and the rest. So if we could look at it from that angle, provide your solution as an API. Whoever needs it could just plug in into their solution and do that. It makes things easier for us, right? So you don't get to build what someone else has built because you want to make all the money. Of course, we cannot survive together.
Thank you. I wanted to pick up on the sustainability point, and you made some excellent points, Robert. I think one thing that you mentioned is it takes time to expand and to grow. Another one is that the pool of patients that you have, that they actually see the value that it brings for them to get checked out, to get diagnosed. Another one is an affordability. Are people able to pay? And so how do you think about those two factors, that people really see the value, that they have to come and should get checked out? And how do you kind of tackle affordability? You mentioned the MTBA, maybe you can elaborate a bit on how you tackle that or think about it. Thank you.
So I think there's lots and lots of things in the world of healthcare that we could provide that we think would be very impactful, but there's not an equal willingness to pay for all of those things. So we were talking with Jael and her colleague about doing nutrition counseling for moms during pregnancy, which I think is hugely impactful. Unfortunately, from our experience, I would say there's very little willingness to pay for that. There's a high willingness to pay for ultrasound during pregnancy, for lab tests during pregnancy, but not for nutrition counseling, despite the fact that it's like very impactful. And so the way that we try to work around that is we try to make those offerings available at a price that is sustainable for us and see if people bite, see if people pick that up. If they don't, we need to basically stop offering that service because it's not something that can be sustainable. I think there's a role for demand generation, which is how do we convince people that this is something that they should spend their money on? And I personally view that as more of the role of governments and NGOs, nonprofits, to try to raise awareness of why should you spend money to get cervical cancer screening or nutrition counseling in pregnancy. We can do it to an extent through our own clinicians counseling people, through social media advertisements, videos that we create. But that's something that happens at this public health and societal level, and so it's very expensive for any one company to really turn the tide on that problem. On affordability, so obviously, you need to be affordable, otherwise people aren't going to access your services. And so I think a lot of what we need to do is find where is that price point where there's enough margin to be sustainable, but you have enough of a mass market. And I think what's exciting to me about Penda is that there's a lot of money in the top 5% of Kenyan earners. There's a lot of money spent on healthcare. It's also a super crowded market. For the mass market in Kenya, that's really underserved by what's there. That's actually a much bigger market. So if you can find an offering that's at a price point where that's really accessible to the mass market, you can actually make a greater return than even the companies that are serving the very top 5%. And that's why Penda thinks this is really such an exciting investment opportunity. And I think you need to do a lot of different pricing experiments to see where is exactly the willingness to pay and for what. And so a lot of our work this year with our business intelligence team is around tweaking pricing to really find that sweet spot.
My name is Faye from Cloud Equipment. We help healthcare facilities across Nigeria and later Africa to get access to the medical devices that they need at zero upfront cost. So it's interesting that you're mentioning pricing, because when we started, we had the opportunity to go to the really large, hospitals, but we didn't do that. We picked an area in Lagos State that is, densely populated. And because we're not charging our facilities for getting the equipment in the first place, we're able to do a revenue share model with them. Part of the kind of benefits that I would like to take away from here, and which I've already started, get for, is around the sort of partnerships that helps us to drive this forward very quickly. Now, because we're going in with, very large ticket items for many of them, we're able to bundle in a lot of things that they don't need to pay out of pocket for. So this becomes a model where an EMR provider, for example, a payment solution provider, for example, somebody who is doing AI can, kind of piggyback off of the kind of things that we're trying to do, because we then can do the split of the revenue with them instead of, worrying too much about charging at a particular price point. It's a very new model. It's a lot of hard work. But if you're looking to build in Nigeria and you're looking for somebody who likes a lot of stress, please reach out to me. I am more than happy to partner with anybody who is ready to do this at a scale that works for everybody. Sorry, that wasn't a question. It was a shameless plug.
Yeah. Thank you very much. My name is Richard Kalunji from Kampala, Uganda. You've been talking about affordability and some of the services that people can't pay for. And I think this is something that we have also faced in a startup, where you say that, you're going to take services to the people and realize that those who largely need the services either can't pay for them or don't think they need the services. So what role does using those services as incentives, perhaps to say you're using nutrition counseling as bait for ultrasound, for maybe antenatal packages that the patient can pay for, what role do the incentives have in as regards building healthcare solutions? And then to Nelson, I know that raising financing is something really complicated for entrepreneurs. And some people have even made jokes that, money does not go to good ideas, it goes to people with good ideas, or money keeps going to the same people, and this we've seen people raising money over and over again, yet others have not raised a single coin. So in your opinion, do you think that entrepreneurs choose not to work with each other? Because I've gone through 9 years of stress, of suffering, and I finally raise my $20,000. Do you think that's the reason that someone feels that the other people should also go their way around it? And then secondly, what role does we, the entrepreneurs that are going through this stress or this trouble, forming spaces like the HealthTech Hub in our small communities? Because sometimes people start accelerators and incubators as real startups to themselves as well. So they don't really understand either types of businesses or our struggles as entrepreneurs. So it's a bit of a mouthful, but I hope it makes some sense. Yeah.
Then we get one last question.
Just to speak on the affordability piece, and I think what you're talking about is bundling. Like, is there a way that you could bundle like nutrition counseling with an ultrasound? And I think the challenge is that our patients are smart. They're very savvy about their finances. And if an ultrasound costs 1,500 shillings and you say, oh, well, I'm going to bundle it with nutrition, then you're only going to pay 1,600. They're going to go somewhere else. It's really that simple. There's not a lot of price elasticity around the price of an ultrasound in our communities. And so at some point, you need to either take the loss and give the nutrition counseling for free, which you may decide to do because maybe from a business model, it sort of makes sense to give that extra value to the patient for free. But you should recognize you're giving it for free and what they're paying for is the ultrasound.
For your question, you have to look at it this way. Entrepreneur, we do classism a lot, right? There's no need to lie. We are all entrepreneurs. We do classism. An entrepreneur who has raised Series A would really associate with a pre-seed or an idea stage startup unless you're in their circle, which is why I mentioned initially that as founders, you have to put yourself out there, build your network, right? So I really don't think per se that because they struggled for 9 years, That's why they are not coming to collaborate with you. I would love to look at this from their own point of view, right? Probably their priorities are different now, right? Someone who is looking at scaling, right, very fast at the moment, and maybe his VC is on his neck to bring money. He's looking for somebody who will connect him to a larger client, right? That's one thing. So most of the time, if we're trying to look at it from both lenses, right? If I'm already having a lot on my hands, I'll look for someone who can be able to help me grow. And I think one of the easiest way for this, we mentioned support network. It's very vital. And one of the things I enjoy about our last cohort is that we have a good support network of funders. I can say that authoritatively from the HealthTech Hub. From Farmer to Livestream to Render, we all communicate. In fact, we share links like this opportunity is there. Come up, we peer review your application. We built that network in the healthcare space. And I think it's something that funders need to work on that, right? I would share one experience I had with Capsule. So Capsule got the Black Funders Fund, and we all celebrated. And the next year fund came in, none of us got it. But Capsule was on everybody's neck. Like the chains guy was on everybody's neck. Apply for this, get this one done, get this one done. So it's your network, let's say, and try as much to move with people that you're heading in the same direction with. Right? It makes things easier. Because it's a very difficult journey. It can be frustrating. Entrepreneurship is that this morning you are smiling, in the evening you are depressed, right? You have to build the circle. It's crazy, right? You have to build a circle and work together, especially in this hub, right? And I'm very grateful to be part of the HealthTech Hub because there are some days I want to close. I will just call one or two persons. Do you know this person? And they say, oh, sister, let me just call them ahead and you're coming down. So build the network. So don't see it as a point of view. You have to, because humans are naturally selfish, right? An entrepreneur, we can be very crazy about our idea, right? I can say for you, you might have a lot of WhatsApp messages that you've not read. And as you get busier in screen, because your time, you don't have a lot of time. Sometimes they might not have the time to go through your messages and reply your call. But try as much to break into that circle because there's always a cabal, whether we deny it or not. There's always a cabal in every group. Everybody forms their own circle, and it takes a lot. So, and the last part I want to point out is that get a mentor. It makes things easier for you. Someone who can say these two things. So, I would give a scenario. So, we're trying to approach the government. I had a mentor or a cardiologist, a very high-ranking cardiologist with almost 10 years experience. So I was trying to get a meeting with the government, and I just mentioned to him that I'm struggling. He just turned and looked like the director was my student. He just carried his phone, placed the call. Someone is coming to see your office, it's from me. Do whatever you want. And that was just it. So mentors make things easier for you, right? They might not have all the connections they have, but they might point you to the right place. They might point you, they might be able to say things on your behalf. Thank God for Lucy. Yeah, Lucy does a lot for us. There are times you see email, and Lucy will just send an email that I've connected you with this organization. I met Ramesh through Lucy. She just send a mail like, I've sent you to this organization, and it makes things easier for you because it might take you 6 months to get to the table with these guys, and someone will just give a word of a reference for you. So that's.
We'll take one last question, and then we'll close this up. Yeah, so.
Hi, great session. Thank you, both of you. My name's Jeremy Holmes. I'm a healthcare investment researcher, and in a previous life, I was a health economist and a regulator. I have a question about the supply chain. Robert, you mentioned it in passing and the difficulties you've had with the supply chain. I've spent the last 2 months in East Africa looking at problems in the medicine supply chain and to a certain degree medical devices, but primarily the medicine supply chain. Can you just expand on your point about that, please?
Sure, very briefly, because I know I'm standing between you guys and lunch. I would say Penda's at a scale where we can do very accurate supply chain planning, even like 6-12 months in advance. Like, I can tell you within 10% how many doses of Augmentin we're going to sell in January 2024 across our network. When we share that advanced supply chain knowledge with our multiple suppliers, and even when we contract with them to get those drugs on a monthly basis at a certain price, suppliers are often unable to deliver key drugs. it may be because they themselves are stocked out of it. Maybe they ended up selling their supply to someone else and because they were able to get a higher price. Maybe it's out of stock in the whole country. All of those things have happened. The end result for us and for our patients is that we don't have a drug that, number one, our patients need, and two, that like we would make money if we had it in stock. So it is a huge, huge problem. One of the ways that we can solve it is by working with more suppliers. One of the ways we can solve it is by increasing our stock holding at our warehouse, which we've done, but as you know, is really expensive. You're adding a huge amount of cash basically sitting in inventory. So I would say it's sort of the upstream supply chain isn't functioning as well as we would hope.
Thanks to everyone. I think what we have had is that scalability is feasible. We need more collaboration and competition, and we definitely need more talks around affordability and supply chain. Thank you so much. Thank you for the wonderful panels. Thank you.
Thank you so much, Natasha, Robert, and Nelson. Very insightful conversation. We are now going to break for lunch, but we'll meet here at 2:30 p.m. We still have an exciting lineup in the afternoon. We'll have 6 startups that will be pitching some of their solutions. We'll also have an awarding ceremony later on. We'll also have a matching session where some startups will get to interact with investors. So looking forward to seeing you all back here by 2:30 p.m. Thank you. Is working on. And to just introduce this next session, I'd like to invite to the stage Ben White, founder of VC4A, which is a network organization for high growth, high impact ventures with 35,000 startups active across the African continent. Ben himself has worked with entrepreneurs in the network to raise in excess of $800 million US in VC funding. So, Ben, you're the perfect person to just tell us what the next session is.
Thank you very much for that. You guys thought we were finished yesterday, right? That we didn't have more entrepreneurs for you. Well, we've got great companies coming up stage today to again share their stories and their progress with all of us here. So we're very excited about that. There are 3 things that I would ask of you as an audience, and as we did yesterday for those that weren't attending. 1, let's celebrate these entrepreneurs. We know the work is hard. We know that these guys are doing an incredible job. So when they come up, let's show them our love and our support with a huge round of applause and let them know that we appreciate everything that they're doing. The second is together, right? We all understand that it takes a village to raise a startup. We have an incredible network of contacts between us. So when these entrepreneurs are presenting, please think about how you can help them. You know somebody, there's an organization somewhere, there's a partnership somewhere, there's an investor somewhere. Please, let's make those contacts available. Let's make those introductions for each other. We have to help each other. The third and the final thing, if you're interested in investing or you know investors that want to be investing in these companies, we will be organizing deal rooms on the 19th and 20th of the month. Please give your contact details to me or to any of the entrepreneurs so we can make sure that you have all of the information and can attend those sessions. But so without further ado, we hand the stage over to these rock star entrepreneurs.
And the first startup that will be pitching to us is Asteraye Lema, Deputy Managing Director, We Care Digital Health. A round of applause as he comes. Oh, here he is. Let me give a bit of background. Okay. So the startup is an Ethiopian digital healthcare platform that enables patients to connect with practitioners for online consultations or in-clinic visits, buying time so that the technical team can have his presentation on. In 2021, he joined the Startup Technologies and became part of the co-founding team of We Care. Okay, the team is ready for you. A round of applause to just give him all the energy.
Thank you, thank you. Everyone can see me, right? All right. Thank you. All right, so We Care is a health tech company that works in the fields of telemedicine and telehealth. We also provide, We Care is a health tech company that works in the fields of telemedicine and telehealth. We also provide home care nursing services, and we have an office clinic. So the problem we're trying to solve, so I had thought of a story to tell you guys, but over the past 3 days, we've heard a lot of personal stories from doctors. All right, so we've heard a lot of stories from doctors, and I realized we share a lot of problems, and we've tried to approach these problems from different angles. And for us, whether it's the patient traveling 3 days to get a 15-minute consultation with a doctor, or just to get a medication refill, or if it's the patient that avoids going to a doctor because he dreads the 4 to 6 hours waiting time. So that's what we're trying to solve. As you know, medicine requires a physical visit, and it's not about just the 20-minute consultation or the 1-hour consultation they can have using our platform. So we're not to avoid that, but we're trying to bridge the gaps. So We Care, in terms of that, we provide a platform where patient can search, select, and book physicians using our application. So they can choose doctors by profession, locality, condition, treatment, or institution. And based on the availability, they can choose their doctors, and then they have their consultation online. We also provide phone call center consultations because not everyone has a smartphone where they can have video consultations. So for our clients, we provide a cost-effective and convenient service, and they get to avoid extended times, and they do their physical visits when it's only necessary. And they get to see certified professionals where they're properly vetted by our team, and we also uphold online privacy standards, so they don't have to worry about data breach and data loss. And the other, so for our partners, if you attended the morning session yesterday, we also have a high number of unemployed professionals, healthcare professionals. So we provide a working space for these professionals where they get to work and they build a reputation. And later on, if they want to open a private practice, it's a good platform to build a reputation. So we've started our operations in September 2021, and over the 2 years, we've registered over 2,500 health professionals, and we had over 2,900 in-app bookings, and we've held over 23,000 call center consultations. So these are our product sets. We have a patient's app, a doctor's app, or We Care Partners app. We provide websites for those using iOS applications, and also we have a call center, office clinic, and home-based cares. And our customers love us. We have a 4.3 rating on Play Store with over 200 reviews, and it's currently the top application in telemedicine category in Ethiopia. And we also have over 38,000 downloads. So coming to the telehealth market in Ethiopia, so we have over 120 million population. My people don't sleep. So, and of those, there are 60 million phone users, and of those are 20 million smartphone users. So currently, we're providing both smart call center and smartphone in-app consultations, because we still need to address the population that is not tech savvy or that cannot afford to use smartphone, because that's where the big market is. And since we're talking about bridging the gap, until they're able to come up to the 20 million, we're trying to address the 60 million people. So there are other platforms that provide similar services, but in terms of comprehensive offering, We Care has by far the most comprehensive offering, where we have video consultation, call center consultation, in-app appointments, office practice, home-based care, and we provide health education through our social media platforms like YouTube, TikTok, and Telegram, where it's big in Ethiopia. And we have over 2,500 doctors network. So our revenue streams. So most of our revenue comes from service-based. That is our in-app bookings. Our call center, our home care services, and our office practice. And the commission-based is for the in-app bookings. So we provide the platforms where the doctors give consultations, and we take a percentage of that consultations. The other one is subscription-based, where we provide packages for organizations. They can for their employees, where they can buy our online consultation, our home care service, and our office practice visits. So we're also experimenting with other forms of subscription, working closely with diagnostics and pharmaceuticals, because having a large network of health professionals can be beneficial in terms of marketing. So our customer acquisition cost is around $7.91, and our customer lifetime net value is $49. So we've generated a revenue of less than $7,500 US. That's not much, but currently we're not really looking to generate high revenue, but to get our products out there, because after all, this is a new product and we're trying to introduce it to the public. So our ask is a hefty sum of 500,000 US dollars, and this is where the money will be spent, and meet our team. So most of us are health professionals, including myself, and we have our chief technical officer who is in charge of the technology, and we have our financial officer. And please have a try for yourself, download our app. Thank you.
Thank you, Asteraye.
As we know, we're going to have a few minutes for a few questions. So if you have a question, kindly raise your hand. Do tell us your name, the institute you're with, and please keep it short. Thanks.
Hi, I'm Niti Paul. I am an angel, but I also work with lots of investment funds. Currently, I'm representing AXA. So just a question, where are you incorporated? Where's the company incorporated?
In Ethiopia.
In Ethiopia. And you work only in Ethiopia?
Yeah, currently,
Yeah.
yes. In Ethiopia.
I didn't see, number of customers at the moment?
We have
Total number?
Okay.
Could you just bring that up again?
Can you show this?
Sorry.
So.
Okay.
Okay.
Okay. So are you okay with where you're going? I mean, have you reached the milestones where you thought you would be today? Is that where you are?
No, because it's been 2 years since we started operating, so we haven't had a large investment in terms of marketing because up to this point we haven't had any outside investors, and we're working on the product, reinventing the product and adding new features. So in terms of the milestones, we're not there yet, and we're not quite happy with where we are, but I think with the right marketing, we as a piloting phase, it's a good stage.
And how much equity are you giving away for that 500K?
We're not ready to give equity yet, but we're looking. So we haven't had a valuation done. So to get how much the company is worth and how much percentage we're trying to give out for that sum. But that's something we can discuss in later stages.
So Steve Tare here, Desiree Ventures, investor. I've actually invested in Yene Health.
Okay.
So that segment, I have a fairly good understanding. What I wanted to ask you is, I mean, very aligned to what was asked before, that's $500,000. How many months do you think can survive with that? Exactly. How do you want to say it? It's a technical term.
Based on the 13-week cash flow we had done, the 500,000 can go a long way, maybe 2 years up to this point, because like I said, we haven't spent that much in marketing. If you've seen our ask, most of it goes to marketing because that's where we're lacking in terms of investment. So, and this is a change from our past approach. Therefore, may not be, but 2 years would be my rough estimate.
Okay, good point. Thank you. Can I add another question quickly? So, essentially, what you're telling us is 500 is going to last you, let's say, 2 years. Most of your expenses go to marketing. Okay. What I was thinking is it online marketing? Is it physical marketing? Because when I look at the product mix, service, B2B, etc., I'm struggling to see, I mean, I'm getting very technical, but anyway. So if you see the marketing versus your existing product mix, if you can go back to it, if you don't mind.
Which slide?
Where you have a B2B, commission, etc. This one.
Yeah.
So the marketing budget, which of these three is you going to boost the most?
I would say for the service-based. So because our products are integrated, like for example, on the office practice, that's a physical space, but those customers come from the in-app consultations. So like we're selling them the whole product, not just one service from the package. So so it's not like we're not marketing just for one specific set of product. So if you're marketing for the app, for example, if we're marketing for that, those customers will end up coming to our office practice. So mostly go to the service-based, I would say. And
thank you. So that means that your customer acquisition, the first way you acquire customer is through online means. and then you bring them to the physical facility as needed.
Yeah.
Correct?
Correct.
Okay, thank you.
Thank you so much, Asterai. Seems like we don't have any other question. A round of applause to... Up next, we're going to get a pitch from Robert Korom, Chief Medical Officer, Penda Health Limited. As the team gets your slide up, he is a board-certified internal medicine physician. Dr. Korom has published several peer-reviewed studies of Penda's work in clinical quality improvement. He works closely with Penda's digital health and technology teams to improve clinical decision-making and enhance patients' experience. Over to you.
Yes, thank you. So this is going to be a little bit of a different, I'm not just going to pitch Penda, I'm going to talk a lot about the technology that we're working on, specifically because it was supported by the HealthTech Hub, and I think it's a really exciting piece of Penda, and I want to share it with you. So in medicine, we always start with a patient case. So I want to tell you about a 32-year-old woman who comes for primary care because she has 2 days of itchy vaginal discharge. She doesn't have a fever, there's no pain with urination, she's had the same sexual partner for the last 1 year. A urine analysis is recommended, you can see the results here. This is sort of a unremarkable urine analysis result that doesn't look like there's a urinary tract infection. And then what I'm showing you here is a written prescription for 2 medicines. And this is something that we see our patients who have gone elsewhere. They come in with this type of thing all the time. So this is ciprofloxacin and metronidazole. Those are 2 different antibiotics. I think for the clinicians in the room who have worked in this market, you know that this is super, super common in our market. It is everywhere. And if I look at the financial impact for this patient, she's paying, in our market, it's a total of about $1,150, which is maybe about $9 US. And this is the wrong treatment, the wrong diagnosis, the urine analysis was unnecessary, okay? So from my standpoint, this woman who has very little funding, she probably spends about $50 to $70 per year on healthcare. She's now spent $10 completely wasted. That's at best. At worst, this is actively harmful, right? Because the antibiotics that she's taking are further killing the normal vaginal flora, further predisposing her to other infections. So this is a huge problem, and we have to talk about quality. And I think we don't talk about quality a lot in health tech, but it's a big problem. There's low adherence to guidelines. In Kenya, they estimate that, the Ministry of Health estimates that only about 40% of care in Kenya is delivered in accordance with national guidelines. Because care is so fragmented, people like this woman, maybe she went one place and had this condition, then she came dependent and hopefully got treated correctly. Now she has a very fragmented health record, so it's very difficult for us to follow that. And of course, we have gaps in early detection. We don't see early cues of chronic illness, and a lot of preventative care is not really done. So Penda is really ideally suited to implement AI in healthcare. We've got 18 medical centers. We're in 3 different counties in Kenya. We've had a decade of partnership with the Ministry of Health. We work with the National Hospital Insurance Fund. We have over 30,000 lives covered under a capitation model. For 7 years, we've been fully paperless. For 5 years, we've had our rule-based clinical decision support, which I'll show you. And all of this has resulted in one of the richest primary care databases in all of East Africa. Here's what our clinical decision support looks like. When a healthcare provider at Penda, a clinical officer, enters a diagnosis, like in this case, diarrhea with mild dehydration, it's going to pop up a couple of suggestions here. One is zinc, and the other is ORS. Again, for the clinicians in the room, you probably know that most children who are diagnosed with gastroenteritis often are given antibiotics reflexively. Antibiotics cost more than these 2 therapies. These 2 therapies are the ones that are guideline and evidence-based, and they're the ones that are going to reduce the risk of death from gastroenteritis and reduce the frequency of recurrence. So these are what ought to be given, and this system is what drives clinicians at Penda to consistently offer guideline-based care. And that's how we've been able to achieve 89% guideline adherence at Penda compared to only about 40% countrywide. So you've already seen this slide. I've talked about how many clinics are in paper-based systems. It's impossible to know what the quality is in that setting. It's a huge amount of work to get to just digitize your clinics at scale. Then it's a huge amount of behavior change to get to rule-based decision support. And now, thanks to the AI for Health challenge put on by the HealthTech Hub Africa, we're going into this era of generative AI decision support. So very high level, how the tech works is we take a very rich text-based data file, essentially. This is basically using our clinical data in our EHR that has, this is a 32-year-old female, here are all of her vital signs, here's all the results of the testing, here's the history and physical exam as documented in text. We output all of that as a very simple text file. We put it under a very customized prompt for ChatGPT. So this is a prompt that sounds something like, you are a senior consultant clinician working in an urgent care setting in Kenya, and you're helping to support a clinical officer to make a diagnosis and a treatment plan. Here's the data that the clinical officer has shared with you, and now we're going to get our co-pilot output, okay? There's a lot of data here. You don't need to read all of it. This is to give you some sense of what's possible, okay? We're still tweaking exactly which of these items are going to actually be delivered in the production environment to our clinicians. We're working really closely with our frontline staff to determine what's going to be most helpful. But certainly, what are the most likely diagnoses and why? Because that's something that a rule-based clinical decision support really struggles to help you with. It helps you match treatment to diagnosis, but it's hard to get it to help you get the right diagnosis. We can have diagnoses to consider because they're potentially serious and how to rule them out. So this reduces the risk that we miss something very serious. I think Dr. Sarah earlier told you about a patient she saw who had a very elevated heart rate, but an otherwise unremarkable presentation. By having ChatGPT look at all of that data and say, hey, something's weird here. There's a really high heart rate. You should also consider pulmonary embolism. That probably would have helped in that case. What other data could be helpful to gather? Lab tests, history, physical examination. We wanted to really include a clinical teaching point because we can't forget the frontline staff. Frontline healthcare workers want to learn. They want to keep elevating their knowledge in their day-to-day work. So by incorporating more things like this and maybe even customizing it to what they're very interested in learning about can really make the work of being a frontline healthcare worker all the more enjoyable. And then this one is also, I think, a really cool idea of having very specific bedside manner advice, where it's even giving sample quotes for what you could say to a patient to help sort of bridge that gap. That could be patient education. It could be like empathy reminders. I think if you have the right staff, they want to do this anyways, but sometimes seeing some of the specific statements, you're like, oh yeah, that's a good thing to say. And I'm sure some of you have seen the data that have shown not only is ChatGPT now able to pass medical examinations with flying colors, it's also been rated as more empathetic than clinicians. So I think bringing in some of that, that capability and helping our frontline staff, the humans who are there, bring sort of the art of medicine that, again, Dr. Sarah talked about, I think is really exciting. What's so fun about Penda is we're at this point where we have the reach of an incumbent, but we're still as agile as a startup. So we're doing more than 1,000 patient visits a day in our branches, but we can still be definitely like the first to market in terms of bringing generative AI into the exam room within Kenya. We have a lot of expertise around implementation. We know how to deploy new tech tools, not just from the tech standpoint, but from the culture change perspective. And I think any discussion that talks about bringing AI in healthcare, we have to talk about being cautious, being conservative, and how we approach this ethically. In the case of this project, this is not going straight to patients yet, right? It's not ready for that. It's not tested enough. But we need to test these things, and the best way to test them is with human clinicians in the loop. So we're going to have all of our, obviously licensed healthcare providers who are looking at this and raising up to us when the advice doesn't seem right, Dr. Sarah and I and our clinical teams, our quality teams, are going to be reviewing the suggestions that are given, reviewing for appropriateness, accuracy. And I think these steps are the key to being able to bring AI and even start to now bring it directly to the patient, which isn't happening yet, but is going to happen. So with that, let me just say, like, help us harness the power of AI. It's all about patient-centered, high-value care. I would love to talk to each and every one of you about this if you're interested.
Okay, any questions for Dr. Roberts? We have three hands.
Hello, Dr. Roberts. Thank you for the presentation. So, two questions. First, does ChatGPT have an API that I can plug into? And the second question is, how easy is it for someone else to replicate this? I mean, if they have an open, API, can somebody else just start this?
Great question. So the first question is about whether they have an API. Yes, they do. Penda already uses it with some of our patient-facing chat tools. It's affordable enough for use in our environment, and it's really easy to set up. So that, from a tech standpoint, that's not a problem. He also asked a question that I'm sure is on everyone's mind, like, hey, isn't this really easy to replicate? Can't anyone just make a ChatGPT prompt and then they'll have what you have? The difference is, and I'm sure many of you in this room have used ChatGPT, if you give it generic input, write me a letter of recommendation, you'll get a letter of recommendation, but it's not really going to help you. If you say, write me a letter of recommendation, here's an anecdote about the person I worked with, here's some of their strengths, here's some of their weaknesses, wow, now it's really helpful. What most other healthcare companies don't have is the rich text that's already digitized. That's a complete set of vital signs, it's lab results, it's a history and physical exam, and those things are hard to build. Dr. Sarah and I have been working so hard to build them over the last 6 years, and now we have the tool to really take advantage of them.
Okay, we'll get a question from this side, and then we'll come to that side as well.
So, thank you so much for a good presentation and project.
Please remember to tell us your name, the organization you're with.
Yes. I am Numbiumukiza Etienne from Nursing Research Club at University of Rwanda. What we are doing, we are conducting the research about this artificial intelligence, specifically the utilization of ChatGPT in clinical practice, specifically in the context of referral hospitals in Rwanda. And I really come up with the small question regarding the challenges we've been identifying. We have identified the ChatGPT is very great, has very great strengths and the associated weaknesses, not only ChatGPT and the other chat boxes and the generative models. For example, the case study we have seen is about ChatGPT can assist medical practitioners in consultation, for example. You take one patient.
Let's please keep the question short. Please get to the point.
Yes. You take one patient, and then for one patient, if you consult him using 2 chatbots, you can see the diagnoses are different. So what are you planning to do regarding these challenges associated with ChatGPT so that the medical diagnosis can be very real and concrete? Thank you.
Yeah, so the question is about, sometimes you give ChatGPT the same thing twice and it gives you different answers. Isn't that a problem?
Different response. Different feedback of different response.
Yeah.
You see the searching after to search, but it gives you two response. Yeah, it don't give you the exactly that you want.
You're saying with one.
What? Yeah.
Yeah, exactly. Exactly. You can give it the exact same prompt and it gives you 2 different responses. And in a sense, that's a strength of it because it is able to take so many different types of inputs. And I think if the same patient case were given with all of the same information and it was giving us different sets of diagnoses, that's something that we would need to know about. And that's something that we're going to be exploring through this project, which is why it's so critical to have human clinicians in the loop. Right? This is not ready to deploy as a direct patient-facing solution.
Okay. And then
Quick question. Renew Capital is my company. Nick Malonga, I'm a data scientist. Fairly simple question. So ChatGPT is your competitive advantage. What alternatives are you considering? If you are, why? If you are not, why not?
And just a clarification, our competitive advantage is that we are highly digitized and care about quality and patient-centeredness. ChatGPT is just a tool, and we're agnostic about which one we use. I think Google's MedPalm 2 is more focused and clinically trained as compared to ChatGPT, and we are definitely going to explore using that. We're open to we'll probably try at some point just switching these around and seeing like which ones sort of perform best. Does that make sense?
Yeah, so Steve Tabia, Desiree Ventures. Thank you very much for the presentation. Sorry. Two questions. Regulatory approval, number one. Number two, data protection, especially because to some extent, some of the information, and I don't know if everybody knows, but most of these tools, whatever data you put there doesn't belong to you anymore. It belongs to them. So don't put personal identifiable data because it is theirs. You cannot retrieve it. Thank you.
Yeah, so in terms of regulation, as part of the HealthTech Hub for Africa project, we are required, and I'm glad that we're required to do this, is to work very closely with Ministry of Health and Ministry of ICT to make sure that they're coming along this journey with us. We're doing a whole event with KHF and many other stakeholders to really get their views on how this is being implemented. So I think it's still such early days, but we're going to walk that regulatory journey with those stakeholders. On the data protection, well before this goes live, our data policy, which is already in place at Penda, obviously needs to be updated to say, hey, we're going to share de-identified data with, in this case, OpenAI. It's obviously not going to have your name, your phone number, but it is going to have, this is a 32-year-old female with vaginal discharge. So that's something that we need to make sure our patients actually understand that that's part of, that type of health data is going out there to another company for response.
Thank you, Robert. A round of applause. We're now going to get our third pitch for this afternoon. And our third pitch is Mr. Sandeep Banerjee, Senior Vice President, Tricog Health Limited. Round of applause as he goes to the podium.
Hi, everyone.
Yeah.
Glad to be here and sharing the story of one more startup, which is Tricog. I represent Tricog. It's into the cardiac health space. And just wanted to start the story. Other way around. I see. Taken a different one. Okay, no worries, no worries, no worries. Okay, I'll start. I think there was a slide which I think it's got missed somewhere. But anyway, we hear this story in every town, every city in the world where you go with a little bit of a burning sensation to a doctor, and the first thing the doctor will say is that, you know, there's a slight bit of acidity or something like that. You take a Rantac, go home, and after some time you feel probably more distressed, and about 4 or 5 hours you are probably lying on the bed, very, very severe. And then the next stage of, 50% of those people don't even reach the hospital. And my founder is a cardiologist. He's an interventional cardiologist. I think he wanted to actually get his hands into this problem. So what we do is very simple. I think these are just a little bit of stats. Cardiac is still the #1 killer in the world. 1/3. I mean, I've picked this data up from the Novartis, World Heart Report 2023, and all the data is as good as in the month of May. So this is not changing. Now, but this graph is important. It shows that after 1.5 hours, how your ability to survive actually goes down, drastically down. So there's something, the concept of a golden hour. Whatever you have to do it in the first 1 hour. And although the treatment for an acute MI should begin within 1 hour, but the truth is that, almost in most part of the world, it's 2 hours and beyond. I can talk about India, which is a very populous country. It's 4 hours. Right? That's the median. Right? It's improved in terms of cities, but if you go to a tier 2, tier 3, there's a lot of struggle. Now, this is basically what we do. We do a very simple stuff. You take an ECG, get me to the TriCog gateway, and I'll give you the report, which is authentic in 10 minutes. Boom, no questions asked. And how do you do it? The secret sauce is only that we have built an AI. We have done close to about 15 million patients right now, and every day we do close to about 15,000 ECGs a day. And what we do is we help doctors, we help GPs, we help diagnostic centers just deliver this very simple, vital piece of their business. Now, this is the steps. You record the ECG, transfer to the TriCog cloud, get the 100% of the ECGs are diagnosed by a medical team, and then you have some alerts, and then you get the report which you receive within minutes, right? And that's the whole steps which is there. Now, I just want to give you a snapshot. Look, the AI which we have today was never built for the customers. It was meant for actually making our doctor's team, medical team efficient. Today, we have opened that AI to our customers. But that's what we do. We have the AI in terms of, it can actually has 1,000+ AI-enabled measurements are there. There are about 140+ heart conditions, heart traces, which we can actually predict from the ECG. And we have got a very, very strong AI. And it's improving every day. That's what we do. Now, this is just to give you a flavor that this is how our doctors interpret. The moment you get it, there's an AI which is there, which comes in, and the doctor also has his own way, accept or reject it. And every time it does that, the AI gets corrected. We have moved on to, this is again a story which is from the Philippines. We expanded to Philippines, and we found out that that's the texting capital of the world. People don't want to use even laptops. They're happy to use mobile. Even the doctors are more comfortable on the mobile. And we created this. You can actually have the mobile platform do everything on the same stuff which you do on your laptop, on your screen. You can do the entire thing in terms of measurements and every damn thing in the mobile. So we have the mobile platform also. So reports are available in all the fronts. You have the vCardia app on which you get the report. You have the email, and you also have the web portal which you can go, enter, and take it out. And this is what you get at the end of the day. It's a 12-lead ECG report. It'll come out in one full frame, 12-lead report. Over the years, what we have done is, coming out from, again, a developing economy, price point is always a big deal. So we wanted to solve that, because if you go into a premium vendor like a GE or, say, a Philips, even our GPs, who are probably the first line of defense in a healthcare system, the primary care, they find that even costly. So we wanted to make that even affordable, and we have come out with our own echocardiograph machine. This is what it is on the left-hand side. We call this as the vCardia, right? And we have a similar solution for the echo, right? On the cardiac, we have two platforms. One is an ECG, one is an echo. In the echo, it's not, I would say, an emergency situation, but what we are delivering is basically improving the efficiency. You can be in any floor, but you can actually get your echo transferred, and you can get the report through. So it's like an echo PACS. It can be an echo reporting, whatever you like. We have actually transported this, and this is the interesting part, for the government. In India, we are working with 5 state governments. We are trying to make inroads into Africa. We are trying to make inroads into other, because in the government space, we believe that this is a big deal. And what we call that is a STEMI grid solution, ST elevation and myocardial infarction, and that's what we have designed this. We have designed everything based on this, right from the infrastructure provision to our STEMI detection with a STEMI alarm on your phone, and quick decision with the thrombolytic stuff, and then rapid transfer. When we do transfer, we have an app, separate app, which is known as the CardioNet. You can actually coordinate between the spoke and the hub. So and 2 doctors can even chat on that app on the clinical information. So that's the app which comes with that. You have the treatment module inside that, so that other doctors, when they come in the later part, can actually see. So it's a complete ecosystem which we have built. And obviously, there is training and auditing and reporting. In Africa, this is what we have done. We have about 4 years old in this place. We have done close to about 130,000 ECGs. We have saved about 9,400 odd lives, and we are definitely growing. I think it's a hard grind, because at the end of the day, healthcare itself is a very hard business. I mean, anybody who's in healthcare, my heart goes out, because we know how hard it is. And when I stand here, I think I really want to probably have the support in terms of many things. You know, help me out to get into the footprint, into newer footprints in Africa. If someone can get me into, because I know the solution which we have can do wonders on the primary healthcare side in every government. And it's an limitless kind of a scenario which you have. Very simple, humble solution, but we have now transported this differently. We have the next stage, which we'll get into the Holter, which should be there in 2024. We also have the TriCare platform, meaning post the discharge of the hospital, we want to push in a developed economy platform, which is basically the one in which the rehospitalization is a big deal in the developed economy. And you come out from a cardiac standpoint and you want to integrate, it's actually lost. You have a pre, you have a hospital, and you have a post. These are not integrated, right? And we identified that another opportunity to play there. We are doing some clinical trials right now, but that's another platform which we are naming it as a TriCare platform, which is we are going to launch maybe in 2025, 2026, but that's something which we are committed to do. Finally, with all the data which we have, we talk of that as the computational and medical data. We have the data. I can talk about ECG, I can talk about ECG to heart failure. I can predict, I'm ready to work with pharma giants who can say, hey, listen, I want to do this, right? ECG, preliminary heart failure, dipstick, get into the echo, do the echo, confirm the, put them into the pharma drugs, and see the entire value chain. So, there are a lot of opportunities which we can work together, and I stand here to probably, with this so many great guys. I mean, if there are avenues where I can probably collaborate, work in some sort of a project, it'll be very good. That's all. Thank you.
Thank you so much, Mr. Sandeep. Okay, we have a question at the front.
Wow, super exciting. I do have, hi.
Steve Tawia, Jazari Ventures. So thank you very much for the presentation, very lively. My question to you is, I can see that in terms of country of operations, mostly Kenya for now, and a few other ones. My question to you is, one, affordability, and go-to-market in beyond Kenya, for example. So affordability and then go-to-market. Thank you.
So one thing is for sure, that I can't demand anything beyond what the consumer pays to the doctor. At best, I can do 1/3. At worst, I can do 1/4 of what the doctor gets from the consumer. I mean, that equation is very straightforward. Whether you are in any economy of the world, you have to make sure, because ultimately my competition today is not efficiency. My competition today is the WhatsApp in which doctors are pushing their reports, and there's someone else, some friend who is basically reporting it. So I am aware of that, and hence I tell you very honestly that it's a hard grind. And I'm aware of the price point. But yes, below 1/4, if it's a large volume customer, maybe a little bit more, it doesn't work out. But when you are offering a service which is like a gold standard, that every report is going through a human eye, I cannot actually, what should I say, subsidize.
So I have several questions right in front of you.
I also have
Okay,
some.
let's
So
first
let
hear
me-
from Lucy, and then we'll hear from the lady at the back.
Several questions. I'm wondering, I've spoken to more than 150 companies working in your space, in the cardiovascular space. What's your level of medical device approvals? Are you a medical device for each of the two components, the AI algorithm?
Yeah.
Let me finish. The AI algorithm and the actual physical device, that's first question. The second question, how are you integrating with health information systems in the countries? What standards are you using to integrate with those health information systems? Do you work with public facilities, private facilities, with both of them? And last, with which of those startups from the cohort are you working, which actually have complementary business models like WeCare, that has, for example, chain of clinics, both physical but also virtual healthcare services. And we have several companies which provide emergency response services, which focus really on that component. Are you working with them? Thank you.
Okay. Happy to take that. And actually, entire landscape, I'm there in bits and pieces everywhere. Because at the end of the day, we are a commercial company. So let's take the first one. The first one, the first question was
medical device status.
Yeah, medical devices. Yes, I have a device, so it has to be a medical device. And it's registered since we manufactured it in India, so I've got the quality registration, which is known as CDSCO, which is there. I have now applied for CE, so that should be there. I'm not going to launch the medical device in the US, so FDA is out of the question. Second part of it is the...
And Europe? And European CE?
And so CE. CE is there, right. So, and like suppose I'm in Kenya, I'm applying for whatever the poison board, which is there, that's the name, right. And, Department of Poison or something like that. And in fact, most of the world bodies, their FDA is actually falls under, because the pharma was the side where the compliance was more, and they have just expanded that. Same is in India as well. And if you go to the US, it's the same thing, right? It's the Drug Administration, right? In India also, it is the CDSCO, Central Drug and Safety or something like that, right? So coming to the point, on my software bit, yes, I'm getting it compliant as far. So there are two parts to it. One is the medically relevant software, which is like the doctors are using it, and that touches the life of the patient. That's going to be absolutely 100% compliant. And there's something which is known as add-ons. I think that's fine. So we have what we call it is we have our internal definition, the blocks of our software, CDS, KDS, that's internal, but yes, I'm on that. Third, if you're talking about data privacy and all those stuff, which can be another one, so I'm there with respect to HIPAA, ISO 13485, all those things are on the path.
It's not so much about that, it's more about, are you integrating with public health systems
Absolutely.
in any way, and how is your data being used by a government in Africa, for example?
So great. I think India has probably started with a very ambitious plan of getting a Indian health stack data. If you know that, and there's something called Ayushman Bharat, that thing, data stack, in which it means it's a very ambitious plan, but that's the ultimate. And they got a challenge in terms of some tech companies. And I'm proud to say that we were actually the winners among the 6 companies. So we are there in that program, integrating that. Now, what does it mean is, and the program is very simple. Today, the data, actually, the real data of any patient belongs to the patient. It doesn't belong to any center. So when the whole objective of today, when the patient moves from point A to point B, the problem is basically the second center says, hey, listen, you got to get your test done again. And that's probably wrong. Now, this data stack allows every hospital's or thing to be integrated to the data stack. I move in there, and I have my mobile, and given access to the doctor via an OTP, you get hold of my data and see what is there. So all my data, which is going to be there, will be there in one place. So that's the ambitious program, and I'm there on that path.
And with which governments in Africa are you doing that?
No, I have not. So those are probably things which I want to explore. Those are things which I want to do. Those are things which I want to really take on. There are places like it has to be a ROI-based economy concept. But yes, I'll be very, very open to look into that.
And the last question: how are you working with some of the complementary startups from the hub?
Believe me. I've been hearing all these startup conversations, and I'm going up to them and telling them, hey, I have something for you. Right? I've got 2 sales guys in Africa, in Nairobi. They have gone around, and probably we have done the low-hanging fruits. We have the MP Shah, we have the Aga Khan, very credible names we have got. But is that all enough? No, I think the world is, it's limitless. There's a lot of work to be done. And obviously, I have the passion, but we definitely need some luck, lots of effort.
So I have a question, Sandeep. You lost your little, Sandeep, hi. Here, hello, at the back. Yes. The little Indian woman here. I'm tiny. We know each other. You were in the Niti Aayog Tech Accelerator. I was one of your mentors a very long time ago. So,
okay, that's very good.
So I know you well, and I know what you've done. So my question today, I'm not representing that bit of me. So I work for an insurer, an inclusive insurance bit of AXA. So my question is around money again, and I have one gentleman here who also asked about money, and I'm going to ask about that. On the customer scale-up perspective, if you're going individually to every provider, it's a really hard sell to scale.
Yes.
So my question to you is around how are you going to scale your business proposition so that actually, and who is your customer in the end? So that's my question to you.
Oh,
and are the insurers, are you talking to insurers, and how are you talking to insurers?
Fantastic. So who is my customer? Trust me, everybody is my customer. Even you are my customer. Because if
but I ain't going to pay for it, Sandeep. I'm not going to pay for this. So that's why I'm asking you the question.
I'm going to give you a home ECG device next year. And you're going to buy it from Amazon.
I'll keep you
and
to
you're
it.
going to use it when you are having a thing, and that signal is going to come to Tricog Gateway, and I'm going to give you the report on that single lead ECG on your mobile, and you are going to go run to a doctor with that, and you're going to thank me, right? So I'm going to do that for you, right? So if you're saying who is my customer, everybody is my customer. Now the question is, as a startup, you actually go after certain things, and I think I was having some good discussions with anyone. It's a hard journey. I mean, I always say this because I know how hard is healthcare. I mean, at some, we all know these definitions, CAC, POP, or I mean, I can rattle off 10 metrics on the financial side, right? The cost of customer acquisition, it's really, really tough. Now, the question is, you need tons of money to burn. Now, here investors, beyond a certain stage, nobody wants to burn. Even I don't want to burn today. So I am EBITDA positive in every place now, right? But am I net profit? No, I'm not. I think 7 years, 8 years, you can't keep on doing that. So the question to you is, who are my customers? My customers are public health. My customer is the diagnostic center. My customer is the GP. My customer is an insurance company. My customer is a pharmaceutical company. My customer is anybody who actually needs an ECG in some
Sandeep,
form.
we're out of time. Maybe if you could wrap up on your last point.
All right. So I think that's about it. I mean, I don't have anything to add.
Okay. Thank you so much. Thank you so much, Sandeep. We're now going to hear from Progress Mahureva, the COO of Dawa Health. Oh, Progress. He holds a bachelor's degree in business management, and he's deeply passionate about maternal health and harnessing technology for the promotion of sustainable and healthy living.
Can you hear me? Oh, sure. Good afternoon, everyone. First things foremost, I would like to thank everyone who stepped on this stage because you're doing great jobs. So I did business management. I didn't do anything medical, so I'm not that medical savvy. That's the reason why even my picture is not there. So my name is Progress. Many of you might be asking why as a business management person, why I am in medical. So it's much of a personal story. When I was 7 years old, I had to go through a process where I saw my mom give birth to my little brother on the road. So at that moment, as a little kid, taking your mother from the house to the road because she wants to give birth, you don't really conceptualize it as something that is serious. But later on, it came as a coincidence where I met with this guy. He's been my friend for more than 15 years. Then we're just talking, thinking about different ideas. Then we stumbled upon Dawa Health. So Dawa Health, what we are doing is we are democratizing access to maternal health. We help mothers because we really understand the problems that pregnant women really face from now and then. And funny enough, even mothers in the cities, they're facing these problems, even those that are near hospitals. Because due to physiological changes, some mothers, they don't even want to go to the hospital. Some, they feel like if they go to the hospital, they're going to be mistreated, which is what is really happening in Africa. And another issue is even if mothers go to the hospital, they are not being served properly in terms of time. And in our hospital, sometimes there's not even the medicine that they require. So, so these are some of the problems that women face. If a woman is anemic, these are some of the problems they face. And funny enough, we did a pilot in Zambia, in Lusaka, and about 75% of the mothers that we did our research with, they were all anemic. So our opportunity is that in Africa, about 30+ million mothers in sub-Saharan Africa, they face these problems where they don't have access to quality maternal health. And of these 30 million, is just 2/3 of the global numbers. So of all the mothers who are not facing, who are having problems in the world, 2/3 is in Africa. And of these 2/3, about 5 million is in 5 million of these mothers is in Southern Africa, And of this 30 million, 5 million are in Southern Africa alone. And another problem that we've been facing, whilst people were talking here, they were saying there's a problem with clinical health officers not being everywhere. Actually, funny enough, in Zimbabwe and in Zambia, we have an excess of 20,000 plus clinical officers. And most of them, they are going to European countries and to USA and all that. So what we've done is we've made sure that in our product offering or in our model, we include the clinical health officers because we understood that even the pregnant women, they prefer that human touch, that human factor in the delivery of that of our services. And so here's how we offer our services. We have a mobile van that we recently bought. So this mobile van, how it works is it helps those clinical officers who are on the ground with resupplies, and it also helps in sensitizing those communities of what we are doing. We have a network of clinical health officers. So these clinical health officers, they're actually qualified. They come from colleges and universities, but they are not absorbed by the current systems. So we found it very worthy to include them, and we found it also very noteworthy to allow them to work within the environments which they live in, because we understand that women are so predisposed to abuse in environments that they can't defend themselves. So, and all of our clinical health officers are women. We have a mobile SMS app, which pregnant women, they get week-on-week help about their pregnancy, the level of their pregnancy, what they are supposed to do, the type of foods that they are supposed to eat. So this is basically how we work, or the model of how we work. So the first step is we onboard those clinical health officers, then we train them, then we teach them about how we expect them to work, more like the code of ethics. Then the second level, the senior clinicians is the one that that is always with the van. They have the supplies, the urinalysis. You can talk of the gloves, you can talk of the cotton, and all those necessary stuff that are needed in delivering our services. And roughly the third was supposed to be fourth. So then after that, this clinical health officer is supposed to onboard. They onboard the pregnant woman. When they onboard they can even onboard the pregnant women even when they're going to the shops and you're going to church. And we are not strict on how they work. All we want to do is to see them help 35 to 70 people per month. So they can choose not to work on Monday, but at the end of the week or at the end of the month, we want them to reach a certain target. Then after that, the pregnant mother that has been onboarded, her account is created on the Dawa Health platform. When the account is created, then she's able to get visits. As you can see, 35 to 70 people a month. Then from those visits, she gets feedback. Feedback weekly about her health. Does she need to change anything? And also she'll be getting help on the week of the pregnancy that she is in. And also, we recently also bought an e-bike, which is an electric bike that we use to deliver the birth kits, because we added a new product called the birth kit, because we understand that a lot of pregnant women, they move from pharmacy to pharmacy to pharmacy to have a package of what is called a birth kit in hospitals that is required when you are giving birth, of which when you are giving birth, you might not even have time to look for the birth kit. So, and the delivery is free, and we also do, conduct tests in the comfort of their homes, and those tests, we deliver them to laboratories, and it's also done for free. So this is what basically our mobile van does for onboarding and sensitization, provide extensive examinations for people. So a woman can be walking on the market and they see the van, they can stop it and they'll get assistance there and there. So through our partnership with an NHS-based specialist, we are now able to check your, let's say you're pregnant, we are able to check your ultrasound. Then using AI, we can tell you the results there and there, but after 3 days, you're able to get an extensive report. So basically, this is the ultrasound scan. We are working on a partnership that is going to be able to allow pregnant women to get to be able to see their baby there and there, because it's connected to the phone. Yeah, so it's a mobile ultrasound scan. Then we have a conversational bot. With a conversational bot, they're able to communicate even when we are not there. It can just communicate with them. With the risk stratification model, clinicians now are able to see who is high risk and low risk patient. So some of our competitors on the market, Access Afya from Kenya. I hope Kenyans, they know this. There's Mobi Clinic from Uganda. These are the numbers that they've been able to save, which really gives us confidence that we can reach these numbers also in a matter of time. So about our business model, the clinician or the clinical health officer pays 1 cent, 10 cents to be on our platform. Once they are on our platform, then us, because we right now we are using only social media to market ourselves. So when we get those, we'll just be distributing them to the community health workers within those communities. Then the pregnant woman pays $3 for triaging. $3 is paid per visit. So it's $3 per visit, because some people, they might not need the visit. So it's not up to us to make them pay. We don't want to make it harder, because it's already harder in their lives. And this $3, it's actually way less than what is currently being charged, because in Zimbabwe they charge $25 to $30, also in Zambia. So we're making it less. And when they pay this amount, we make sure that we save them for at least 30 minutes to an hour. So it's about how we ask them about their background. They tell us if there's anyone in the family who's been having the same problem, if they are being abused and all that. So it's not only about us making money, but understanding the patient. So the birth kit, we sell it at $9, so they can pay it 3 months, 6 months, payment methods. And we've made it that flexible because we understand how vulnerable they are, but also how essential the birth kit is. So we've made, they pay $15 per trimester, and that $15 caters for ultrasound scan and the drugs that we are able to deliver to them, folic acid, your iron, and also we are able to do hemoglobin testing and urinalysis testing in the comfort of their homes. And these 2 tests can be sent to the laboratories, as I've said. So this is the annual serviceable market in sub-Saharan Africa. 30 million mothers are without access. This is more like a big country of just pregnant women without access. Then 5+ million women in Southern Africa alone. We are hoping that by 2030 we'll be able to service 1.2 million mothers. And it will be very great to work with some of you guys to make sure that we achieve that goal. So this is the amount of people that we've managed to serve, 5,000+. On our platform, we have 120 health agents that are just waiting to work within different communities, and this is in Lusaka alone. So we are looking forward to be working with the Lusaka government because we are just in the final levels of being approved to work within their hospitals, so that we can help mothers. And we have a project that we are doing, that we are about to start, that's going to allow us to do to onboard 100 health agents and 20,000 patients within the next 18 months. We are hoping we'll be able to scale this project, but also whilst learning, because it's always about continuous improvement and continuous learning for us. So this is our superstar team. There's Safadzo Monzwa, who is the CEO. He's also a doctor and a web developer. There's Charity Piri. He's a medical licentiate and a clinician. There's our CTO, Chungu Takunda. He's also a medical doctor. Aaron, who is also an economist, and myself. And these are some of the partners that we've been able to work with. I think it's been small, so we couldn't put all of them. But we are very grateful to these guys and others that are not there because they've been putting a lot of work for us. So this is a bit of testimonials of the people that we've worked with. We have a lot of more stories that we've managed to document. Some of these women had different conditions. We've managed to have other women who managed to have serious cases. We've managed to save women who are HIV positive. We've managed to save some who are mentally challenged and all that. But it's an amazing journey, I tell you guys. So what we are looking for is we are looking for partnerships to do our research and developments within the countries that we are operating in. And we are also looking for diverse board members from finance, health, technology to sort of strengthen our decision making and our growth. And we are also looking for tax and legal support for Pan-African solution. And as you know, most governments in Africa, they don't have any policy or policies that are strategically made for startups. So we really need help to cross-cut that. So thank you so much. Oh, they changed my number. Oh, so yeah, that's my number there, my email address. Thank you so much. Any questions?
Hi, thank you very much, Progress, for the presentation.
Sure, you're welcome.
So you've really spent a lot of time on the how, etc. You lost us a bit, I have to admit. Number one. Number two is, I think you underestimate your market. 30 million pregnant women, I think, is way underestimated.
It's an annual, though.
Yeah, still. Okay, number two. And then number three, what I would say is that I'm not sure how you make money. You showed me all these things, but I still don't understand how you actually make money and come to a point where you may be sustainable. So explain that, please.
All right, sure. So we started in 2020. So from 2020, we had some funding that we got. So it was for us to scale, but also to do research. So we're researching on the model to see if our model really fits in. So we spent a lot of money. And maybe your question would be, how did we spend that money? So what happened is, because our model was that we would get a car, then we'd drive the car. Myself, the medical licentiate that was on the picture, then the lead, the other guy who is an economics guy. Then we went into these communities, so we would call these people, then we go into these communities every day that they tell us, right? But the problem was we were using fuel to go into these communities, 1, 2, the food was expensive because you have to cater for lunch for 4 people. We had to cater for fuel, and fuel was expensive.
Progress, you have less than a minute.
Serious?
Yeah.
All right, so
research.
So how we make money is from the $3 that is paid per visit, the medical clinical officer makes 40% of that, and we get 60%. But also from the birth kit, our birth kit costs $9. On the market, you would get it for more, but even if you get it for less, you won't get it in one place. And we get 10% from every delivery that we do of urinalysis to a laboratory. And we get 10% from 10 cents from the clinicians because we try to make it easier for them. Very short. Thank you.
Last question. Keep it short. Keep your answer short as well.
Okay, sure. I wanted to find out why you're not charging more, because I mean, it costs $25, right? That's what they're paying. So why are you charging $3?
So there's a research that we were doing in Zimbabwe that I'm just compiling right now. So believe it or not, the less expensive insurance in Zimbabwe is $38, and there are some people who earn $50. So what we are trying to do is to go as low as we can, so that that person who is earning $50 a month can be able to afford our services. That person, because we've seen some people who are charging $10 for our services. It's okay. But with our market, we believe, and we have also asked people, because all that I told you, we got it from the market. Obviously, we had our own, perceptions, but we went to the market and we tested it. And most of these things that I showed you is the people that told us this is what we want.
Thank you so much, Progress.
Very sure. Thank you so much.
Our last speech for the day is Alex Ronson, General Manager, Weberg Medical. He has over 15 years experience in management across 5 continents for both the private and the public sector.
There's a step here. Watch out for that. How does this work? Which way is it? Is it this way or that way? That's not me. Anyway, thank you all for coming this afternoon. I apologize in advance if I speak too fast or swallow my words. I skipped lunch and I'm a bit hungry. No, I'm kidding. But I do, speak fast. I do swallow my words, so I'll work on that. But thanks to all the other presenters here. You guys did an amazing job. I'm glad to finish this up, so I'll be quick so we won't linger too long. Anyway, here we are. Perfect. So, who is VBEG? It's a data-driven data-driven procurement platform that makes medical supplies and equipment affordable and accessible. So, how does this work? Nope, not that way. Which button do I push? There we go. Yes. So, every minute, 5 people die in developing worlds due to treatable diseases. During this speech, we'll have like 30 people die. That's terrible. Why does that happen? Because of a broken medical supply chain. Poor inventory management, improper procurement. Most of the procurement in sub-Saharan Africa is done by paper. It's not done digitally. They don't really know what, clinics don't know what they need. They just buy what, they think is good and what they can get at a cheap price. And what happens is they don't have the right tools to treat the illnesses that they're facing. So what did we do? We created something called the V-Procurement Platform. And it's an online platform where clinics can go and they can order what they need and they can get it. And not only can they get what they need, but we also provide financing for it. So clinics, they go and they say, okay, we need this. And it's there, and then they have the option to then get the financing, and the financing is either from us directly or it's from partners that we have. We have banks that we work with. But a lot of times, as I said, they don't know exactly what they're doing. They don't know what they need to procure. So we created this, the health demand simulation model. And what that does, we get data from the Ministry of Health here in Rwanda, and we're getting data in other countries, including Kenya and DRC. And with that data, we analyze where there's high demand for certain diseases. So for example, we can look at the data and say, in southern Rwanda, there's a high prevalence of malaria. So we'll reach out to clinics in southern Rwanda and say, hey, we're seeing that you have this equipment, you're treating this many clients every day or every week. If you buy this equipment though, you can treat many more clients and you can generate more revenue. And then our procurement team comes out and they provide them with the equipment. So what we do is we come to them and we say, look, you buy this equipment from us, it's going to cost you this much per month, we'll provide you with the financing for it, but you're going to generate this much revenue. So right away, immediately for them, it's like a no-brainer that, we're going to make money off of this. And we're using the information that we've gotten from the Ministry of Health and predictive AI to gather that information and figure out what the best options moving forward are. And what that does is it makes it affordable, it de-risks, and it creates accessibility. Meaning, here in Rwanda and all of sub-Saharan Africa, access to capital is really hard. So if we can come in and we can say to them, hey, you don't have to put anything down up front. All you need to do is you order the equipment, we'll work with the banks or we'll do the financing ourselves, and over the course of the lifespan of the product, you're going to end up making money off of this, and we show them how. So this is our solution. We do the demand prediction, and then we optimize the delivery routes. We work very closely to make sure that we have the most efficient delivery routes throughout the country, also in Kenya and in the DRC. Right now we're operating just in Eastern DRC, in Goma and Bukavu, but we will be expanding to Kinshasa. And then we do supply prediction, so from that we can make sure that we know to have the right inventory in stock for us, so that when clinics and pharmacies and whatnot come and order from us, we have everything there ready for them so they can get it quickly. And then, so the total market here is $46.8 billion. We see demand in the next 2 years of 2 million and 40 million within 5 years. There's tremendous opportunity here. So our competitors are mostly just suppliers. They don't have the tech aspect of it. They have, they have product, they go out, they sell it. A lot of times they'll sell it just at low cost, but they're selling low quality stuff. We're trying to sell efficiently marketed and pointed products at a price that is affordable. And because of the financing aspect, we can make it affordable. We can make sure that everybody can afford what they need. And nobody has that. There's a couple companies that have equipment financing, Elara and us, but then nobody else has the platform and the health demand simulation. All right. So this is our financial projections moving forward. This year we're on pace to do about $3 million. Next year we hope to do, that's a little bit high, 7.5. It'd be great if we get that, but reality is we're looking to get more closer to $6 million in revenue. And then moving forward, we're going and going. We have 400,000 medical products sold, monthly revenue of 200,000, and we work with 850 healthcare providers in the 3 countries. So this is what we're asking. So we say we're asking 1.9, but the reality is we're only asking for $900,000 because we're in the process of closing funding with Johnson & Johnson and Sanofi for $1 million. Johnson & Johnson is actually going to really support us on the tech side of it. They're going to help us to build out that. And Sanofi wants to provide us with medical equipment and supplies, medicine, basically. So really what we're looking for at this point is just $900,000. So if anybody has it around, we'll take it now. No, and this is what we want to do with the funds: equipment financing, technology, and marketing and sales. And then we predict, again, next year to do about $6 million in revenue. I skipped this slide. Oh, here we are. Anyway, yeah, there's our profitability. So yes, so we'll do hopefully $6 million in revenue for next year. And then this is our team. Tobias and Alex, they're the co-founders. Tobias is from Austria, Alex is from Kenya. They got together one day and said, hey, there's a gap here. There's a need that needs to be filled. We can fill it. Patricia is our COO. She's fantastic. It's her birthday today. If you see her, wish her a happy birthday. And then there's me. Yes. And altogether, we're a team of about 30 in Rwanda. We have 7 in Kenya and 6 in DRC. Yes. And we have to end with an African proverb because that's by law. It takes a whole village to raise a child. So thank you. And any questions? You have a question. I know you do. Yes. All right.
Thank you very much.
Did I eat all my words? Did anybody get anything I said? Was it clear?
We got everything.
All right, sweet.
Sure. When you see Tobias, say hello.
I will.
Yeah. So thank you very much for the presentation. I think I see your numbers are really cracked on.
Yeah.
Question to you. Looking at your, I would say, your supply chain today, where do you see friction? And I'm asking that question specifically in the context of AfTA, the Africa Continental Trade Agreement, where there's a lot of things that could actually ease your supply chain. Thank you.
Friction comes in many different places. First of all, thank you for the question. Good question. Friction comes in many places. There's a lot of competition here. Oh, It didn't work? Oh, there, sorry. I can just yell. No. So yeah, as I was saying, friction comes in many places. It comes in the supply chain process. It comes in competition. You know, here in Rwanda, a lot of our competitors, they're bigger than us. And what they do is they will corner the market on a certain product, and they'll hold it out until everybody needs it, until there's a demand and nobody else has it, and then exactly they're going to jack the prices up. It's difficult. So we are actually looking at procurement from out of the country. We have procurement from India, from China, from Europe, from Kenya. So we're trying to create as many different procurement sources as possible, so that we can really minimize that friction. But the reality is it happens.
Sorry, I had a complementary question. Affordability of the devices. Because even if it's pre-financed,
right,
it's still expensive.
Yeah.
Thank you.
So affordability is an interesting question, because a lot of our clients say to us, you know, we want cheaper products. And we say to them, look, we can get you cheaper products. We can get you really cheap products. The problem is that in a month, you're going to call us and say, this product doesn't work anymore. So we really have to convince them that there is value in spending a little bit more money. And we also do have competitors here who will sell the cheapest products at the cheapest prices, and they don't care if they work or not. And you know, as far as medicines, they'll be either near expired or at expiration date. And you know, we don't do that. We acknowledge that sometimes we're going to be a little bit more expensive. We try to be competitive. You know, we are lowering our margins to be competitive. But you know, the reality is, you know, garbage in, garbage out. You want cheap, you can get cheap, but it's going to break or it's going to make your clients sick. You know, and we don't want to do that. You know, that's not our business model. Any other? Oh, in the back. I totally missed you guys. Didn't see you over there.
Hi, Alex.
Hi.
So the supply chain space is very complicated.
Yes.
And I'm still wondering, what's your actual business model? Is it that you sell subscription? Is the tech coming from a subscription perspective? You're also talking about the sourcing aspect of the product. Are you working directly with manufacturers in terms of the sourcing of the product? And then when it comes to the payer, is the payer the contractor or the payer is the supplier? Because I'm a bit confused in terms of an understanding of the chain of your product.
Okay.
Yeah.
First of all, thank you for the questions. Excellent questions. Our business model is an interesting question because there's a debate inside the company. Are we a medical supply company or are we a health tech startup? And the answer is we're both. You know, we started out just purely medical supply. We, you know, procured supplies from Kenya, from India, China, Europe, brought it to Rwanda, sold it. And we said, you know, there's a better way. There's a better way to do this. There's also a million suppliers. You know, there's a million companies that are bringing in equipment, they're bringing in medicine, they're bringing in consumables. That's a very competitive market, and it's not one we want to be in long term. Long term, we want to build out our tech so that we can actually, and it's not subscription based, the tech, we're using it for our sales force right now. So we're providing them with the information. We're saying, hey, look, there's a hotspot over there for tuberculosis. You know, go reach out to that area and let them know that, hey, you know what? There's a great demand for tuberculosis equipment that you're not meeting. So it's internal for us right now. However, long term, we want to make it so that we simply provide the tech, and then, you know, we provide it to suppliers within countries so that they can do the supplying themselves, and then we get a small portion of their sales. You know, a small percentage. Yeah. Did that cover everything? There was a lot in the question. All right. Sure. Happy to do it. All right. Any other? Yes?
Yes, Alex. So I have a question surrounding your financing model. I mean, it's super helpful to, you know, to a lot of businesses. The further you have, you let them pay later. But I'm concerned, what is the average payback period? And what is the default rate? Because I mean, there's, you know, Africa, that's some of the challenges that businesses have.
Right. So I'm going to tell you the default rate, and you're going to say, no way, that's not possible. It's 3%. See, not possible. But it is, because what we do is we actually score out all our clients. You know, we do a risk assessment of every one of them, and we go to the banks and we say, hey, look, you know what, this is their risk assessment. And a lot of times the bank, not a lot of times, but sometimes the banks will say, look, we can't do that. And sometimes we do the financing internally. Now, as far as default, we have a lot of clients on the books who haven't paid us, who, in many ways you could consider them a default, but we don't because we still have hope that they will pay us one day. So that's why it's 3%. As far as, I'm sorry, what was the other question as far as the financing? So what? The payback period. It really depends. Its average is about 18 months. Yeah, that's typically what we're seeing. But we go up to 36 months. We'll go short as 12 months. I mean, ideally, we'd love it if you pay up front in cash, but that's a dream that we have all one day. Yes. All right. Any other questions? Oh, another one. You should just keep the microphone.
Nah. What is the average cost of a device, or maybe extreme, min and max?
Look, they range from 10 cents to millions of dollars. There's no. No, we've sold in the hundreds of thousands. We've sold MRIs and X-ray devices. Yeah, but yeah, look, the cost of a device. How much do you want to pay? We'll sell it for any price you want. Yeah. Oh, 2 more questions.
Thanks a lot for the presentation. I'm Ramesh from Novartis. I was just curious how you manage stock in a way. I saw you have, 10,000 SKUs, and if there's a hotspot on malaria, I guess you want the product tomorrow if the client wants it.
Yeah.
So how do you deliver fast, and how do you manage stock and the cost of stock?
So 2 ways. We try to do predictive stocking, but sometimes when we see that domestically there's an issue, there's a sudden high demand, we do domestic procurement. We will go around to other suppliers and buy from them. Unfortunately, the problem with that is you do it twice, and then the third time they cut you out and they go right to the consumer. Which, as long as they're getting the medicine, ultimately that's the goal.
So to kind of go back to Sharon's question.
Yes.
I get your current business model, but actually you produce, or rather, yes, you get access to so much data. So the current companies such as Capsule who work and kind of generate commercially available data, do you consider them in the future as competitors or partners?
So we actually work very closely with Capsule.
So you don't want to sell your data?
No. Capsule is our partner where, why do you want to buy?
No, because I think it's a valuable commercial source.
It could be, yes, in the long term, and we actually have discussed that with Capsule about selling data in the future. But for now, we're not selling it. We're using it internally, but we may in the future.
You're welcome for the advice.
Sure, yes, and if you want to make an offer on the data, we're happy to do it. Oh, question over here.
Thank you, Mr.
Mr. Alex.
Alex.
No worries.
So I like your apps. It's a good apps. So I like to it's maybe like a recommendation.
Sure.
How do you think about to put AI automation in your platform for some hospital need to know which the products, if you can automatically know this hospital needs some products, some materials, some, yeah.
Yeah.
How do you think about?
So within the health demand simulation model, we are developing predictive AI, which will, help us work with hospitals to determine what their needs are and what their demands are, prior to them actually realizing it. We are trying to integrate, certainly here in Rwanda, we're trying to integrate with the hospitals and the clinics. Some of them are more technically challenged than we'd like. That's just the reality. But the ones who are technically challenged, we can integrate with them, and we can work with them to really meet their demands without them even having to recognize it. Their system automatically will reach out to our system and say, hey, we need this, and we'll send it. Yeah.
Thank you so much, Alex, for that amazing presentation. And that wraps up this session. Amazing, incredible presentation. We've had 5 incredible solutions. Let's just give all of them another round of applause. And as Ben shared earlier, if any of you are really interested in investing in any of these startups, just feel free. You can approach any of the startups, or you can also approach Ben from VC4A. Here he is, here is Ben. And if you also want to join the deal rooms as well as get more information about the deep dives, just feel free, approach Ben, he'll give you more details. So for now, we're going to get into another session of strategic partnership and opportunity matching. I'd like to invite both Christelle Ijihozo, Senior Program Manager, Bridge for Billions, and Rocio, Impact Monitoring, Measurement and Evaluations Lead at Bridge for Billions, to tell us more about the next session that we're going to be getting into.
Thanks, Fiona. Hi, everybody. Yeah, it's great to see you. And I'm just going to briefly tell you about what we are going to do in the next hour. And my colleague Rocio will tell us about clear instructions of how that's going to happen. So, I mean, over the course of 2 days, if you're with us, we've had discussions around very important topics. And one of the things that came up is the importance of partnerships. Partnerships between startups, partnerships with startups and investors, startups with development agencies. So we are trying to make that happen, and we are very sure that all of you here are going to help us achieve that. So one of the things that we want to achieve with the conference is really for this conference to bear fruits in terms of creation of partnerships. So we have about 10 startups with us this afternoon. All of startups are here really seeking to create deals with investors. I've seen some familiar faces here. They're looking to create partnerships with development agencies and other startups. And that's what we are going to facilitate in the next hour. So we are going to have semi-structured one-on-one conversations among startups and those partners that I mentioned before. And before Rocio tells us about exactly how that's going to happen, I want just to say that we want these conversations to be straightforward and strictly focused on creating partnerships and investment opportunities. So we are going to call upon all the partners here who are willing to create those partnerships here, right now, to follow the instructions that Rocio is going to tell us, and really try and create those partnerships and yield results from all the conversations that we've had here today. So I know we have Virgo Africa, I know we have Black Pearl, I know we have some people from the Global Fund, we have people from the Novartis Foundation and others that probably I didn't get a chance to talk to. We also have other startups that are part of the HealthTech Hub Africa network, and those that are not part of the HealthTech Hub Africa, you could also be a client to our startup. So we want all of you to be a part of this session. And yeah, I hope that's clear. And I will let Rocio tell us exactly how that's going to happen.
All right, thank you, Christelle. Well, first of all, also thank you to everyone for having been here all of these days, taking your time to really listen openly to the startups. And now I want to ask all of you one thing. We want all of you to think about why you're here. What impact can develop from the connections made at this summit, and not just in the air? What literal impact can create from potential investors opening up their pipeline, even to potential startups that aren't ready yet but might be ready in the future? Multilateral organizations, corporates, foundations, what type of partnerships and strategic partnerships can you have with local innovators that you heard, solutions that you were interested in? There's also some startups that didn't get to speak yet. You could talk to them and just listen, because you might also have opportunities opening in the future. And more than that, also B2B clients, startups being B2B clients to each other, and anyone interested in incorporating any of the local innovations. So with that in mind, I want you to really considering also the time of the startups, are you open? Are you hungry to create these connections, to establish these relationships with local innovators? If yes, just think you're in group 1. If not, it's also okay. I mean, this is also an ecosystem building type of initiative. It's also about just building the health tech relationships between higher up multilateral organizations, the government, etc. So then consider yourself in group 2. So in a moment, we're going to ask each of you to divide. On one side, on that one, startups and potential partners interested in having relationships with these startups in the present or in the future. And on the other side, actors that are not necessarily interested in direct relationships with the startups in the present or in the future. And then before we divide, I just want three small instructions. 1, startups and partners, please be hungry but also open for these relationships. 2, partners, please be straightforward about what you're looking for in startups. I was trying to network throughout the event and found that it's also at the beginning, there's also a bit of just quick conversation, but take this session to be hungry, to be clear. What are you looking for in startups? Like, take care of the startup's time, because you might not be interested in them and there might be somebody else in the room who is. So think about what you're looking for in startups, and also be clear about what you're seeking for yourself. Everybody has interests. Everybody can take advantage, win-win relationships. So yes, startups and partners, please be clear about what you're looking for from startups. Startups, be clear about what you're looking for from partners, whether you're looking for B2B clients, investors, or just strategic partnerships. And so now we would like to divide that side, group 1, whether you're a startup or you're a partner looking to have a relationship with a startup. And on that side, everybody else, which you can also network among each other, take a break for the next hour, and then we will convene back. Good. Yes, okay, let's do this. All right, great.
Just as I'm thinking about
Our eventful for you guys? Did you find it very fruitful? Yes? Okay, collectively, let me just ask. Can I get a resounding yes? Did you find the 1 hour fruitful? Okay, now we're going to continue with the next session on the program. We are going to have a presentation, and this is going to be a partnership announcement. And help me welcome to the stage Mr. Ndeye Absa Genige. Hope I pronounced that right. Madam, I tried, yeah? Okay. She's the Senior Innovation Platform Officer at the Africa Development Bank. And amazing outfit, amazing colors. Let's also just give that another round of applause. Representing the continent.
I was so shocked that I almost fell here. So thank you so much. I think we've had such an amazing journey. These 2-3 days were just amazing. I think beyond the fact of just sharing and just learning from each other, I need to commend Lucy. Please, a round of applause for her before I start my speech. Thank you for your resilience. So there is something more difficult than doing a pitch. I think it's a pitcher having to read a speech. So today I'm representing the director of what we call the Public Health, Nutrition and Social Protection of the African Development Bank. My name is Ndeye Absa Nying. You can call me Absa, and I'm in charge of what we call the Innovation and Entrepreneurship Lab at the bank. And my work consists in doing exactly what you've been doing, but for the departments across the bank in itself, and in insisting in the fact that it's important that we start investing now in these startups and the enterprise support organizations for us to be able in the future not only to have an impact, but to improve lives and to have a sustainable impact in the regions we're covering. So as we are about to conclude an outstanding event, let me first thank you all for all what you've shared. The two of them? Okay. Thank you all for what you've shared. Thank you for your expertise, and thank you for building the next generation of innovators in national health systems that are sustainably financed across the continent. And as you know, Africa faces major deficits, and not only in financing for health infrastructure, but the billions in capital expenditure currently being faced by the governments each year is far below what we can do. And COVID has taught us that the need for greater investment is actually the future of investment. And the crisis has also left African countries with severely constrained resources and rising indebtedness. But there is hope. There is hope because according to a July 2023 market intelligence report by Salient Advisory, there are about 350 startups helping at the moment bypass long-running challenges around efficient distribution of quality health products in Africa. And many of these startups also experienced a boom during COVID-19 pandemic. So there is a need to support you, but there is a need to support governments in understanding what the entrepreneurial ecosystem is. And as mentioned by President Kagame in 2018 during his keynote address during the World Health Assembly, health is the currency of progress. So therefore, I'm excited, I'm beyond proud to announce that there will be a collaboration between the African Development Bank and the Novartis Foundation and partners in helping in building a blueprint, because as I mentioned, there is a need for the governments to understand beyond finance and dollars, that currency that President Kagame was talking about. So that blueprint will help in identifying policy frameworks to support innovation in a set of countries to be defined by the partners, and with the will to expand as we evolve on our learnings. So ladies and gentlemen, I know it's difficult to stand between the awards ceremony and the next intervention. I would like again to thank you so much, and I invite you in connecting further, because beyond the money, isn't it, Steve? There is something absolutely invaluable, and that's the power of a network. Thank you.
Thank you so much. We're now going to turn our attention to the screen, and we're going to hear from Marisa Leffler, Health Program Director, UBS Optimus Foundation.
Esteemed guests, on behalf of the UBS Optimus Foundation, I'm delighted to announce our partnership with the HealthTech Hub Africa today. Esteemed guests, on behalf of the UBS Optimus Foundation, I'm delighted to announce our partnership with the HealthTech Hub Africa today. We are joining as a catalytic partner to support the Blueprint Initiative, a public-private mechanism to fast-track health tech innovations in public health systems in Africa. The UBS Optimus Foundation has a history of over 20 years of driving positive change for the world's most pressing challenges. We're committed to advancing access to quality primary health care in low and middle income countries, and this partnership underscores our dedication to improving health outcomes across the African continent. The UBS Optimus Foundation was established by UBS, the global wealth management firm, to help clients and employees achieve more and better outcomes with their philanthropy through programming support and innovative financing mechanisms. When our long-standing partner, Village Reach, approached us with the Blueprint Initiative, we immediately recognized the need and its transformative potential to bridge the current gap between innovators and public health systems, thereby accelerating access to life-saving technologies. Many health innovators often struggle to navigate the complexities of public healthcare systems in Africa. On the other hand, governments lack visibility into fit-for-purpose tech solutions that can respond to their health system needs and priorities. The HealthTech Hub Africa will use the findings of the Blueprint Initiative to facilitate the integration of innovations into existing systems and ensure they reach the populations that need them most. Village Reach has been at the forefront of advocating for the integration of tech-enabled solutions into primary healthcare systems for years and is best positioned to bring the Blueprint Initiative to life. So I invite all of you to join us on this incredible journey. Together, we can make healthcare in Africa the best it can be. Thank you.
Indeed, partnerships are crucial, and more partners are coming on board, as well as we have many other partners, as you can see, who continue to make these kind of platforms come a reality and also continue to have important conversations like what we are having and today, as well as also in the past few days. So a round of applause to having partners and partnerships. Yeah, because it's good to have partners who align with you, have the same vision. Now, for the next session, one that I'm excited about, it's on the HealthTech Hub Africa Awards. And to tell us more about this, I'd like to invite Mr. Pablo, the CEO and co-founder, Bridge for Billions.
Thank you so much. Yeah, I can use this one. Okay, so the moment of the day. Hello, everyone. I'm Pablo Santofemia. I'm one of the co-founders and the CEO of Bridge for Billions. Thank you for having me here. It's really a pleasure. Thank you, Lucy, for making all of this a reality, actually. These last 3 days, one of the things that we've heard a lot is that entrepreneurs, I'm a founder myself, and actually I did my Bridge anniversary last week, so I started 10 years ago. And as a founder, I know that we get asked for a lot of things. Not only you have to have a great business model, a great product, or a great service, you need to know how to lead a team, you need to be a great speaker, you need to be a great, communicator, speaking to the finances, you need to be the best salesman in your team. You need to be a lot of things. And we know how tough this is. So one of the things that, from the HealthTech Hub, one of the intentions that we had was, yes, it's great to ask for these things, but it's also, and as a founder, I know how valuable it is to provide recognition. So today, we are going to do that, to provide the recognition, because as some of the founders today express, the journey of being an entrepreneur, yes, you do need money, but sometimes the visibility is crucial. So today we want to give visibility to 4 exceptional individuals that made a lot of contributions to the HealthTech Hub. So to start, I'm going to start introducing the Mentor of the Year award that recognizes a mentor who provided exceptional guidance and support to the startups in the 2023 cohort. This person, you'll be surprised, she was a mentor to 3 entrepreneurs that actually, the 3 of them completed the program, 100%. And if you speak to any of the mentees, they really speak marvelous comments about her. So I'm really happy to announce the HealthTech Hub Africa Mentor of the Year Award 2023 goes to Abiola Ashuniyi. And we're going to hear, because she's right now not present in the room, we have a video that she made so that we're going to hear some of her words.
Congratulations to their team of the HealthTech Hub Accelerator, I first would like to say congratulations to their team of the HealthTech Hub Accelerator, every startup that participated in this accelerator, and all the mentors, funders and partners that worked on this wonderful, insightful accelerator. This is actually to the good of health tech across Africa. I'm excited and thrilled about receiving this award as the best mentor. This is for other mentors that have committed to much time, energy, and effort in getting to contribute to Africa's growth. Thank you again for this award, and I look forward to contributing more to Africa and seeing all of the startups that have participated in this accelerator grow into unicorns across within the next couple of years. Thank you. Cheers.
Thank you so much, Abiola. Probably you're thinking about us right now. So the next award is for someone who was extremely committed to the program and made a big difference. This is the Community Engagement Award that recognizes a startup founder who has shown exceptional engagement in the program and has actively engaged in the program's community. This person really was very diligent in all the program's activities. And one of the things that as founders we know, you can have the best opportunities in front of you, but if you don't grab them, you're wasting resources. And this person actually, grabbed every single opportunity that was in front of her. So it is really my pleasure to announce the HealthTech Hub Africa Community Engagement Award that goes to Elizabeth Adeshina from Wasima Health. And we are also going to hear some of her words in a video right now.
Hello everybody, greetings from England. My name is Elizabeth Adeshina. I'm the CEO and founder of Wasima Health. I'm so sorry that we couldn't be there with you in person today, but as CEO, duty calls. I was thrilled to learn of this nomination and graciously accept it on behalf of my team at Wasima Health. I would like to say a big thank you to the HTHA team for recognizing my outstanding contribution to the HealthTech Hub Africa program. The program has been impactful for my startup in a number of ways, and we look forward to continuing to implement and put to good use all that we have learned. I would like to say a big thank you once again and hope that you all enjoy the rest of the summit.
Thank you, Elizabeth. So now I'm gonna share the mic with a very special person also for the Bridge for Billions team, Belize Niwemwari, the partnership leads at Novartis Foundation. Can you come?
Thank you, Pablo, for making me a part of Bridge. I love it. Thank you, everybody. And I'm going to present 2 amazing awards for 2 outstanding people that are part of the Hub. First is to Alumni Achievement Award for the HealthTech Hub Africa, which goes to Baba Jide Oke. Jide is part of the 2022 cohort, and he has gone on to achieve success in his field. And personally, I think he's an amazing entrepreneur and a great friend, and I look forward to all the work that we'll be able to achieve together as part of the alumni group of the Hub. Okay.
Oh wow, I'm blushing. You can't see it though. So I didn't know I was getting this award. I got a call from Sharon. I was like, Jide, are you going to be in Kigali? I said, yes. She was like, okay. That's the one. So, and then she was like, you might be getting an award. I said, okay, sure. I'm coming anyway. But thank you to everyone in the HealthTech Hub. I mean, the Hub has been amazing. Support from everyone from, Belize to Sharon to everyone. Lucy, thank you so much. Anyone if I need a connection, and I bother a lot of people, bother Lucy quite a bit. And she, every day, always happy to make a connection. I think the HealthTech Hub program has been amazing. Also, like working with other founders within the group. It's such an interconnected hub. I think that's one thing that's great about the HealthTech Hub. It's strictly healthcare, and then everyone kind of has the same ideas, and you can bounce around ideas and learn from each other. I think that's one thing that's amazing, and looking forward to more in the future. I think that's it. I didn't write a speech. I just freelanced that.
Thank you, Jide. And for the last award of the night, I want to... Okay. Somebody's ready for reception. I want to acknowledge and recognize outstanding achievement and contribution made by a woman founder in the field of health tech. I want to recognize Daisy Isiaho. As a lot of people have touched on throughout the last 3 days, it's not easy to be a founder, but I think it's not easy to be a woman founder even more, especially in health and in tech. And she's doing an amazing job and paving the way for younger generations and making it seem achievable or look achievable or paving the way. So congratulations, Daisy, and I don't think she's around, so let her, if they have a video, play it.
Hello everyone, I hope you're all doing well. I want to express my heartfelt gratitude to the HealthTech Hub Africa and the entire community for honoring me with the Women Founder Achievement Award for 2023. It's a true privilege to receive this recognition, and I'm deeply moved by your support. Our journey at Zuri Health has been a remarkable one, and I owe a significant part of our success to the incredible resources and mentorship that the HealthTech Hub Africa has provided. This award isn't just about me, it's a reflection of the dedication and the hard work of our entire team at Zuri Health. I wish I was able to join you in person today at the summit in Kigali, but I'm also thrilled to celebrate with all of you virtually. I'm looking forward to a future where more women founders can follow their dreams and achieve their goals in the health tech sector. Thank you once again for this incredible honor, and I'm excited to continue making strides in the world of health tech. Let's inspire others, break boundaries, and create a brighter future together.
Thank you so much, Belize. Definitely the awarding ceremony acknowledges, as well as also just creating us a spirit of wanting to create more and also provide more opportunities for other people. So hopefully next year, you never know, all startups who are here, it could be you. It could be you. Continue doing the amazing work. So all the awards will be given to the awardees, those who are not here. And for the closing remarks, I'd like to welcome back to the stage Mr. Pablo, who is the CEO and co-founder of Bridge for Billions.
Thank you so much. I'm going to try to keep this slightly brief. I think probably some of you might be tired after very 3 intensive days. So these last 3 days, we've heard a lot, we've learned a lot, and I wanted to bring the perspective of everyone who is in the room, all the different actors in the ecosystem, and end with homework. Because we know there is a lot more to do to keep improving the digital health or the health tech ecosystem in Africa. So whenever I talk about ecosystems, I like to use the MIT framework that it's shaped with, it looks like a star with 5. And basically the 5 actors are the entrepreneurs, the investors, the corporations, the governments, and the universities. And from day one, we've heard a lot about the governments, we've heard a lot about the entrepreneurs, the investors. We've heard slightly less from the private sector, and probably not so much from the universities. But what I want to do is to really do a very small recap of some of the things we've learned, and also recognizing what has already been done by the partners here and many of you who are here, and some of you that had to run to the airports and might not be already here. So I'm going to start first with the corporate sector. And we will not be here, or at least I will not be here, definitely, if it wasn't because of someone who had vision within a big corporation. And I really want to thank Lucy for being so brave in a sector and within a structure that many times doesn't provide or incentivize risk. If we're here today, it's because of that vision. I really, really want to thank you in the name of everyone because of that. That really takes a lot of courage. And here is the homework part. How many of you know really large, structures, global structures, where they do have the capacity, but they're not either brave enough to do it or don't know how to do it? And I do think that if you know, corporate partners, directors in corporations, to really show them the way, not only in health, in any other sector, that it is possible. It does take a lot of effort, you know it. But we really need a lot more of this. And the private sector, let's say the big fish, they can no longer think that they cannot swim in an ocean with lots of small fish. It is in the best interest of the corporation to work with the small fish. We're moving to a world where it's no longer about the big fish and the small fish, it's about the fastest fish and the slowest fish. And I think there are very smart people realizing this and acting on this. So not just from the philanthropic point of view, from the business standpoint, it makes a lot of sense. So I wanted to bring this because is one of the key actors, but the other key actor that we talked a lot about is the government. And we talked about the need for interoperability. We talked about the need of cross-country interoperability. And this is a big challenge, and it takes a lot of courage. And all across Africa, there needs to be really brave governments that are willing to take the leap and start shaping and listening to private sector, entrepreneurs, investors, and even listen to universities that have a lot to contribute. And it's my first time in Rwanda, and I'm very, very surprised with everything that I've learned so fast. I wasn't new to the Rwandan context, but I'm new to being physically here. And I do think many countries, not only in Africa but globally, we have a lot to learn from. And I think these 3 days have been a great example of the power of vision. Then I want to move to investors, and here I do think the investors in the room, definitely thank you for being here. Thank you for trusting the HealthTech Hub. Thank you for already even making investments in some of the startups in cohort 1 and already moving into making investments in cohort 2. We wouldn't be here. We know how valuable that is. But I also want to invite other investors or people that know investors to remember, I forgot who mentioned this, but among all the billions of dollars invested in Africa, only 150 million are invested in HealthTech. I think it was Steve. Yes. And this is a big problem. But think of, out of these 150, and I don't know the data, Steve, but how much does it go to early stage entrepreneurs? When you look at any BC report, you look at the numbers. As an entrepreneur myself, I used to look at these reports and I'm like, where is this money? Because I don't see it around. And it really takes courage for a business angel or a VC to really bet on entrepreneurs that might not have the best business model and might not have the best pitch. But being able and having the courage to see through and seeing the talent behind is something that we need to be more generous. What happened in San Francisco, in Tel Aviv, let's not think that it just happened only because of the government. It also happened because there were really brave individuals that were willing to invest in projects that no one wanted to invest. And I take the health sector, like health investment or impact investors or any group of let's say any ecosystem of investment that is not very well developed, it has taken a lot of failures for the success stories to come. So I don't want to ask for patience, but it is what we really need. And I know, and I come from a country where a lot of the wealthy have invested a lot in brick, in houses, and now moving to startups, and they don't know how to do better. But I do think, from the potential that this continent has, I do think that investors can play a critical role. And I really wanted to thank the ones that are here, because they're really paving the way for something that is really, really difficult. No one wants to be the first one to fail and lose money. So really, thank you for that. Then I want to move to universities, and here I'm not going to speak. I know I've interacted with a few actors that are collaborating with universities, and I do think we cannot forget academia, because academia is the engine for knowledge sharing. And I do think we need to be more strict and more demanding with the universities, and understanding that creating the skills for a labor market that doesn't really exist anymore is not enough. So I do think we all know professors, we know universities, and I do think we can share what is happening here and bring it to the classroom, and also taking the classroom to here. And what I'm saying with this is, in the health sector, it's not just labs, it's not just research and development. It's really the people that are graduating from university next year, that in many cases, they don't know how to become entrepreneurs, and they hear they want to become entrepreneurs. And remember that systems don't change overnight. They need a lot of support. And I do think that leaving these 3 days, I will encourage you to think of how can we engage the universities of Rwanda, the universities in your countries, to collaborate more with the actors that I've been mentioning. And then the last one I left for, the last for me is the founders. And I really, the first day I asked a question about, how do we take care of ourselves? And as I said at the beginning, entrepreneurs, we get asked for a lot. And I had a burnout in 2019 after almost 6 years of working nonstop. My body couldn't take it anymore. And actually, it wasn't my body, it was my mind. And this was a very difficult moment because the thing that gave me the most satisfaction was also the same thing that was hurting me the most, and it was Bridge for Billions. And it took me a lot of courage to change a lot of things. And one of the things I used to hear a lot was, you have to, in order to have a good mental health, you need to exercise, you need to do yoga, you need to do meditation. I'm like, on top of raising funds, leading a team, now I need to start doing yoga? Like, is this really the way for me to achieve mental health? And I do think that entrepreneurs, founders, we know very well our limits, but we believe we're the only ones that can really change the situation. And I want to say that one of the biggest lessons that I learned is that if you want to, and this is, at least from what I know, an African proverb, that if you want to go far, like if you want to go fast, you can go alone. If you want to go far, you need to go with others. But we know that when you are in that founder seat, you really want to go fast because you have people behind that depend on you. So how do you do it? How can you go far and fast? Well, the first thing is you cannot forget about yourself. And I'm saying this, I'm leaving in a few days. I'll be happy to chat with any of you. But one of the things that I've learned that is one of the most valuable lessons in in how to solve this conundrum is been really loving myself a lot more than my project, than my business. And it makes sense. We are putting hours and hours to develop our baby. We know the impact that it can have, and we know what's at stake. But if you do not take care of yourself, you will not be a good, you won't be able to take care of this baby. And I'm saying this because many times the other actors that I just mentioned don't bring up this topic. But if we were all in the car of any of the founders and the driver was the founder, would you like the founder to be falling asleep while they're driving? Would you want the founder to be, taking medication every 15 days because something hurts in their body? Probably not. So I just wanted to say this to the founders and also to bring back and say, what can we do, the other actors in the ecosystem, so that we are slightly more aware of what it takes to launch an enterprise and what it takes to launch especially a health tech enterprise. And with this, I just want to finish saying thank you so much. I've learned a lot. I have to say that as a founder and the work that I do, which is connecting and acting as a bridge, these last 3 days really connected to the purpose of why I started Bridge for Billions. Some of you might wonder where the billions comes from. So I knew that the ecosystems were in many cases broken. We needed bridges, and we needed really brave individuals that have innovative solutions to local problems that were solving the problems of the billions. Hearing your pitches, and even not hearing your pitches, but speaking to you after, I really see the dream of Pablo 10 years ago, because you guys are really doing that. So I really wanted to thank you for allowing me to speak and for having me here. So thank you so much, and I wish you the best.
Thank you so much, Mr. Pablo. Very encouraging and very caring, because majority of the time when we're in summits like this, it's always, oh, you need to make money, investor returns. If we tend to focus a lot on the serious things. So thank you for bringing out the caring aspect and also just reminding us that at the end of the day, we need to take care of ourselves. And I really hope founders, startups, even investors, that is going to be something that they are going to consider. So this really wraps today and wraps amazing 3 days of the Investor Summit 2023. Can't add anything else, just a few things as we wrap up. I'd like to say that for those who got invitation for the CDC Africa dinner, transportation will be provided. Protocol will assist you with that. I'd also like to mention, I'm sure majority of us know that the Mobile World Congress is also happening at the Kigali Convention Center, and it has also provided a platform for some of the startups that we saw today, alongside other startups who will be also pitching their solutions to a larger audience tomorrow at 3 p.m. at the Kigali Convention Center. This will be at the HealthTech Hub Africa Startup Pitches at the Better Future stage, in foyer 1C, tomorrow, 3 p.m. So we would all love for you to come, join in, and really show the support as you have for the past 3 days. And last but not least, we're going to take a group picture to just capture this moment, capture the last 3 days. And we're going to start with a group picture with the speakers as well as our partners. So for any person who was on a panel today, any person who shared a presentation, as well as our partners, kindly walk to the left side of the room. We'll have the photographers, will help you with setting up. So that is going to be the first group. The second group will have a group picture of all the startups. And then the third group will have everyone in the picture to just capture every person who's been with us today and sharing this moment with us. So let's start with all the speakers and partners. Yes.
Can you hear me anyway? Yeah. I would like to take her.
Thank you so much. Thank you. Really appreciate. If we could have everyone kindly, starting with the speakers alongside the partners. The photographers will show you where to stand. And then the second group is startups. And then lastly, we will all be in the last group picture. Thank you.